So I'll give a start. Good evening, everybody. This is Dr. Apurv Mehra, and I am representing Team Cerebellum here. The Cerebellum family is right on the screen, and they are here to talk to you about the path ahead. The NEET PG is over. If you go to the Cerebellum YouTube channel, you will find a lot of videos where different aspects have been covered by the universe boss, right? What to target, INICT or NEET. That's for the people who want to go ahead. But if there are people who want to take up a branch and look at the career options. So before I go ahead, I remember I went to one of the countries for a conference, and there we were talking about knee replacement, what implant to choose. And the surgeon only made one slide, and the one slide was that this is a better implant, and there was nothing else, and the talk was over. Then knee replacement, there was a slide that what is the determinant for range of movement? The answer was pre-operative range of movement. So, सबसे पहले to give a start, I will request Dr. Gobind Rai Garg to finish a talk with single line, and then I will get back to you again. Goga bhai, choosing a branch is very, very critical in somebody's life. What are your golden words for the same?
Thank you, Dr. Poor, and hello everyone. So single line I will say is scope जो है ना वो ब्रांच में नहीं बंदे में होता है. ठीक है. So whatever branch you choose, ठीक है, तो you can rise in that. I finished. मैं जा रहा हूँ. Bye.
Thank you very much, and I will request all the family members to please stay, because now the thing comes, and I will just like that Dr. Vivek sir, can you please welcome all the students here on behalf of Cerebellum family?
Yes. Thank you so much, Dr. Apurv sir. Hello, students. Hello, dear students. Thank you so much for being here at this time on a Sunday evening. Thank you to all the faculty also. And dear students, congratulations on your efforts that you had put in the NEET PG exam. Result doesn't matter. You are here. That means you are looking at a professional, wonderful career ahead. Welcome on behalf of Cerebellum Academy. Apurv sir.
Thank you very much. I think it will be very appropriate to get voice of Dr. Praveen here to welcome everybody. Sir के आते ही थोड़े बच्चे और join कर जाएंगे.
All right. So thank you, sir. So the reason for this session is that now many students are confused what to do, which branch to take, and all of us can share our inputs and maybe guide the students. So yeah, Apurv sir.
Thank you, Praveen. थोड़े से हमारे जो है followers लाने के लिए, बच्चों को अंदर लाने के लिए. And let me invite Zainab also to do the same work. Zainab अभी आगे मत बताना, प्लीज बच्चों को ले आओ.
हेलो बच्चों, आ जाओ क्लास में. So so we are going to be talking about I think the pros and cons of what we have experienced as you know specialists, and what all opportunities lay ahead in different fields. So that is the intent here.
Right.
Zainab, the interesting thing is everybody will walk to me and say, I will take up medicine, I will take up surgery, I will take up ortho, I will take up everything. And at the end, radio मिला, मैंने radio ले लिया. एक महीने बाद कहानी सारी यहीं पे खत्म हो जाती है. So I don't know how it goes. And now we have one of the most wonderful voices in Cerebellum. Dr. Sparsh, why don't you just welcome everybody?
Hi everyone. Thank you so much everyone for joining in and watching us at this point of time. We hope that this session of ours conducted by the wonderful family members of Cerebellum team is going to be helping you choose your branch, and perhaps we are able to answer some of your queries that you may be having for your branch or for that matter for your college. As always, best wishes.
I will just introduce who all are there, whom I can see. I can see Dr. Jhanvi here to guide you about anesthesia. I can see Dr. Raina ma'am to guide you about gynae obs. I can see Dr. Gaurav Nagpal to speak about ophtha. I can see Dr. Amrit Nasta sir to speak about surgery. I can see Life is Beautiful, Dr. Anand Bhatia to speak about pediatrics. We have Dr. Ankur who will be playing a double role to speak about biochem here and probably about the other subject as well. We have Dr. Devyani to speak about micro. I can see Dr. Srinivas to talk about derma, one of the most sought after branches today in the world. And then we have Dr. Dilip sir. That is a special thanks to him. He is in between the class at Hyderabad. And you know, it is so important for him to take this session, so that he took out a break and he's here. We have Dr. Atul in the session. We have Dr. Praneeth. and we have Dr. Shrikant Verma. So we have
Is Dr. Dilip in the bathroom? I can see the wash basin and soap and
भाई
everything.
वो faculty room है यार, वो faculty
Sir,
room.
this is the
कुछ ज्यादा ही determination हो गया.
faculty room in Hyderabad Champions Badge.
Great.
So I think I will just pass on the mic to Dr. Dilip sir, because he's between the class and come out. The students are waiting. There are two things which I realize are very, very important here. What I feel, one question that students have in mind is MDMS versus DNB. Second is, first option I am getting MDMS in another branch, but I wanted something which I'm getting in DNB. All right. The third point that people talk about is the saturation in branches. And if it's not an end branch, right, about the future exams. What I tell you is, if you love a branch, take it, whatever you're getting. Dr. Praveen already has made a video on the same, and he has also posted multiple times on the same. So if you know what you want, it is absolutely you should choose. It is just like if you know the person whom to marry, the venue doesn't matter. So choose the branch that you wish. That is all. And second, the saturation point is asked to me a lot in orthopedics. Look, a branch which is evolving with technology will never be saturated. There will be something coming up now and then. Knee replacement came, then computer came, then robot came. If you keep on updating yourself, you can never die. So any branch is there, you will always survive and progress. I was seeing a beautiful post today in the morning, which was मुकद्दर का सिकंदर में जो वो है अमिताभ बच्चन is riding a bike. There is a tempo behind and there is a scooter behind. Amitabh Bachchan is the only one out of the four things which kept on evolving and is still surviving. So whatever branch you take, you should keep evolving. Look at the example. You know what Goga Bhai said, scope bande mein hota hai. He took up a branch and he killed it. That everything was killed with it. He started teaching on the board and was the pioneer of going online in medical world. So this is how you do it. You know, you look at Dr. Vivek sir, and he kept on creating books after books and books after books and kept on studying, where his guidebooks is being replacing actually the textbooks. I know he doesn't like me saying that, but सच्चाई को कोई बदल नहीं सकता. So I think we go to Dr. Dilip sir. Sir, there are certain things you would like to share about medicine as a career, as a physician, because if somebody comes to me, if we remember, if we look at AIMS counseling, सबसे पहला seat medicine का खत्म होता है. This is the first seat that gets over. It has been perennial throughout, right, Zainab? This is the first seat that gets over. Medicine gets over radio. पता जरूरी है सबको पता होना. So over to Dilip sir.
Thank you so much, sir. What you said is absolutely true. For the same reason, I was kind of ranked 32 in AIMS New Delhi exam during those days, and I couldn't get medicine, honestly. So this is something that's one of the most sought out fields. I mean, whether you believe it or not, whether you have studied medicine in undergraduate or not, anyway, you wanted to take up medicine somehow. So I think like first thing I wanted to say is the difference between the MD and the DNPs, because this is some question that I've been keeping on getting. So whether it's okay or not okay. So I can say from the perspective of what I am seeing in the DNP hospital for the last maybe 10, 12 years since I started practicing. Before that, I didn't have any exposure because I've been working only in the government colleges. But what I've seen with DNP is kind of more transparent environment, because generally you don't get the toxicity that you get in government hospitals sometimes. So it's more transparent environment. Consultants will be there. Yes, of course, you will not get more chances in the sense you will not get sometimes hands-on training maybe in the first 1-2 years. That's true. But you get to learn from medicine perspective. I think surgical perspective, Amrit sir is there to explain. But at least from medicine point of view, I can say the advantages are more with DNB compared to the of MD. So in the last 5 years, if you see, there is no stigma with regards to MD and DNB. The both guys are getting paid in the same fashion, almost very similar. And in fact, there are a lot of DNB guys, I can say, who are actually earning more than what I'm making right now. So that difference is no longer existing. That's what I want to say. The most important. So if you guys have that stigma, whether to choose MD versus DNB, if you are getting TNBC, well and good. Just go ahead. If it's a good hospital, just discuss with the people over there. And if you're okay with that, I would say just go with it. It should not restrict anything. And I don't think DNB has bonds either. don't have any bonds also. So like at least in government hospitals, like you do have some bonds. For example, if you do in TN, you have 2 years bond. You have to do that. Or if you have to break it, you have to pay money. But DNP hospitals don't screw you with any bonds as well. And only probably like 2 things that people get scared of DNB is maybe the pass percentage. But trust me, guys, I've been a mock examiner and in fact an examiner in DNB exams for so long. And what I've seen, the trend in the last maybe 5 years is students who are good are supposed to pass. It's not like, I mean, MD at least you will be some favorites for some professors or some assistant professors. So that favoritism or not being favorites may be an issue, but in DNB that issue is not there because anyway your exam is going to be somewhere else. And if you're really good, if you're really prepared well, and you are bound to pass and nobody can fail you. And most of the time exams are going to happen in a very neutral fashion. And it's just about whether you're prepared well or not prepared well, that's it, nothing more. And I mean, that's the one point, the first thing about the MD and the DNB. So my opinion, if you get DNB in a decent hospital, just go for it, don't stop just because you're not getting MD. And second, coming to the point, so why you should take internal medicine. So I have like certain features to say like why you need internal medicine and why you don't want to take internal medicine. So I'll say some points. So why you should take internal medicine. First is the scope of practice. It has a very broad and wide range of practice. In the sense, you can be a GP, you can be a specialist, you can be anything, wherever you want. You can practice in metropolitan cities, you can practice in second-tier cities, you can practice in villages, you can practice in your own home. You can do your setup in your own home. As simple as that. So its scope of practice is huge. It's unimaginable. You can do practice anywhere and everywhere. If your ambitions are a bit low, obviously. And second is, of course, the intellect. So obviously, like most of the times, medicine guys are seen as people who think a lot. And obviously, you get that respect in the hospital as well. For example, in my hospital, whatever may be the problem, maybe it's obs-gynae problem or surgical issues or orthopedics issues or whatever may be the issues, even non-clinical branches. For example, take my pathologist or microbiologist or radiologist. All of them come to me as the first opinion. So they see you as a very intellectual guy. If you're good at it, definitely they will see you as an intellectual guy. So
Yeah,
that's
what medicine guys think at least.
Dilip sir, ortho, surgery, and gynae people come to you for intellect advice. Okay, noted, sir. We will talk to you.
Yes, sir. I mean, I'm not saying intellect advice, but the routine, sir. Most of their families, I'm only taking care.
This session may go in a very different direction.
यार ऑर्थो वालों को ना सब दिमाग वाला मानता ही नहीं है.
Sir, I'm not saying coming to ortho. They're not coming.
Dilip sir, I have 2 questions for you, Dilip sir. You said that DNB medicine is as good, but do you think that in majority of the hospitals, the teaching, I mean, teaching may be very rudimentary even in the MD courses, but there has to be some teaching at least. Do you think that when it comes to teaching, maybe MD would be better than DNB?
Again, sir, it's my perspective from people what I've seen around. So in Chennai, if you see, my hospital also has a DNB, not in medicine, but we have it in pediatrics. And if you see, there is another hospital called Sundar Medical Foundation, and for pediatrics, there's another hospital called Child Trust. Honestly, they do really well. They teach very well. And there are good teachers, and most of these teachers are actually retired professors from the government hospitals.
Okay.
And those are the ones who are like after retirement, they come here and they start their practice. So it depends again.
Yeah.
Obviously, like I don't know exactly about all the institutes, but what I've seen, like they do a good amount of teaching. The only cons I would say the surgical branch where they don't get good opportunities. That's absolutely true. But when it comes to medicine, most of the things, it's something that we observe and learn, according to them. So
and
more
so
than
the pass percentage, do we have any quantification? I mean, a couple of years back, it used to be very dismal. So I'm not sure whether it has changed or not. I mean, are we hitting 50%, 60% now?
Yes, sir. I mean, when I go as an examiner, one thing I find is like people who really fail are people who don't know anything. And like very basics of basic questions. For example, I used to ask, maybe we start at an MBBS level, maybe at a final year MBBS level, the same level we ask the question. But once the candidate is not able to answer those questions, that is where they get failed. So generally, they don't get failed. So for example, last time in our hospital, the exam was conducted, 7 people out of 10 passed. I mean, that's a big number compared to the overall number. 7 out of 10 passed. And the remaining 3 who failed were basically people who didn't answer well at all.
Okay.
it all depends on like probably the knowledge. I don't think they purposefully fail in DNP.
Okay.
Like in
Because
MD, it may be possible, I feel. Maybe it's your own college.
in the past, the numbers used to be really bad, 10%, 20% pass.
Now it's better, I guess. Now it's improving.
It's better then it's good. Okay.
Dr.
Probably
Dilip,
better because many people are taking up MD. I mean, DNP nowadays. I mean,
Mm.
boldly, they are good students are also sometimes boldly taking up DNP.
Yeah, one of
and
our students
Presently,
only
sir,
350
another
rank.
thing.
She took DNB in Gangaram Hospital, 350 rank only. I mean, she was getting everything, but Ria, I remember she took DNB in
And
Gangaram
there are,
Hospital
yes, sir,
medicine
there are
only.
very good students. In fact, last year we had a DNP pediatrics candidate who scored like some 2100 rank. Like he would have easily got MD pediatrics, but he took DNP pediatrics at Child Trust Hospital. Like I can tell so many examples. Students are now good students are also preferring DNP.
I think one of the reasons is bond. There is no bond.
Exactly. No bond. Absolutely no bond. And you get exposed to, I would say like environment is more neater, less toxic, and you don't have a lot of colleague pressure. Like because there are very limited students, you don't have so many units to work upon.
And
And
so
you can tell
what are the disadvantages of DNB? I mean, you have spoken all the positive things. What are the bad things about DNB?
bad things is only depending on the hospital, the exposure may be very poor, sir. And again, it is more individualized approach. But at least in MD, you'll have a whole group of people to work up. So if one person is not teaching, other person might be still be doing something. But here it's totally consultant based. If the consultant is not good, if he's not speaking anything at all, and he's supposed to be like that for the next 3 years.
So in DNB, are we supposed to work with only one consultant?
It depends on the hospital again, sir. Many times, like some people may like somebody and they keep with them.
Okay.
The resident is good. So those kind of things might happen. But generally, sir, they do have rotational posting. They have specialty postings, everything. Cardio, neuro. Just like what you have in MD, everything is there in DNB also. The only maybe another con I can say is the case group exposure. Definitely, it will be less. It will be just 1/10 of what you see in MD.
Right.
Goga bhai wanted to say something.
Dr. Dilip, some students were asking about scope of family medicine.
Yes, sir. Family medicine, I told this to some students. Maybe people who wanted to pursue more of geriatric practice, and it has of course. Let me tell the positives first. So generally, people who get general medicine are not going to take family medicine, obviously. So nobody is going to leave general medicine and take family medicine. So these are people who don't get general medicine. That's why they can come into family medicine. And people who don't want to deal with emergencies, but they still want to be in the medical field. And they don't get the other fields like medicine or surgery or anesthesia. They don't get those branches. But they still want to be in the context of the patients, with the patients. For them, it's a good opportunity because most of the corporate hospitals now require a person who can take care of the master checkups. So because most of the corporates see the MHCs as a funnel, like that's how they filter the cases and send to the specialties. So everywhere they require some family medicine people. So for two reasons, one for the MHCs and second for the geriatric population. And second advantage is they can do home visits. And I can say a lot of family medicine people who I know who just earn more than what I earn just by doing the home visits.
Yeah,
Because
can they do DM later on? After family medicine, can we do DM in any of the specialties?
No, sir. Mostly it becomes an end specialty most of the time, family medicine. After that, some institutes are giving fellowships, but not exactly DMs or other things that we can do, sir. It just closes over there. I don't think there is any scope after that, family medicine. But that's why I said those people who don't want to be in a hectic life, those don't want emergencies, don't want headaches, and want a very peaceful environment, just outpatient practice, want to visit home, take care of these geriatric patients, more of preventive aspects like vaccinations and osteoporosis management.
But Dilip sir, if we talk about practice, I mean, if family medicine person is working in a hospital, then it's okay. But if you end up opening your own clinic, then anyways it becomes a 12-hour or 13-hour thing. And I mean, you really cannot
that's true in India, but actually in US, family medicine has a big scope.
Yeah, so that's true. But I think our discussion is more towards the Indian student.
Yeah, scope. But maybe what I'm trying to say is in the future, it may improve, sir. The scope may improve depending on the situation. Maybe we don't know what's going to happen in the next 10 years. Maybe there could be some algorithm from MCA or something where that time suddenly family medicine might boom. So where people might have to see family medicine first like in US and then go to other specialties. Or government itself may set up some small clinics to begin with family medicine. We don't know, sir. There be something that might happen according to.
I think one good thing about family medicine is that once you are done with your family medicine and you open your center, you can do fellowships. There are so many fellowships available nowadays. People are becoming diabetologists, people are doing diplomas. And in fact, I'll share the story of one of my friends, a very good friend. He did community medicine from MC, but he always wanted to practice. So he went on to do, I think, fellowship from Medanta in endocrinology and did some other fellowships. And he has a great practice now in Delhi, doing very well. And he has huge number of patients. So I think when you get into these clinical branches, the level of practice that you can achieve depends entirely on you. And the rules of private practice at least are very different from what we see in the hospitals or in the government setups. There is no ceiling. So, yeah.
Dr. Dilip, another thing, some students are asking about pulmonary medicine.
Yes, sir. Again, that's a routine question they get. Pulmonary medicine is actually a good branch and it opens up into multiple super specialties as well. One of the important super specialties that it opens up is going to be the DM critical care. So they can do. And I think only in central institutes like AIIMS, I think they're having a separate course on DM critical care and pulmonary medicine after doing MD pulmonary medicine. So if you think in that perspective, I think you can do, it's an advantage that you're doing a specialty course in 3 years. So generally to finish the DM, it takes around 6 years for us, 3 + 3. But this is one area where you can finish a specialty in 3 years. So that's a kind of an advantage. But the problem is again with the Indian practice because the referrals may be very poor to pulmonary medicine. So most of the people will refer to pulmonary medicine only if they need a bronch or probably if they wanted a VATS or maybe something like some interventional procedure. For that only they refer the patient. It's very rare, even including me. I'm an internist, even including me. If you see, I don't really refer to a pulmo that easily. Say I get a pneumonia, I treat them.
Dilip
I get a COPD, I treat.
2020 to 2023, it was all pulmonary medicine in the world. That was the time it was all pulmo medicine with COVID coming up. That's what they all were doing. That was the time.
Dilip sir made a very good point that, if you talk about the practice, in India, referral system is non-existent.
Yeah,
I'll share a very small story. I started practicing in 2015. I joined a small hospital. And, when you join as a psychiatrist, you go and talk to all the medicine guy. And I talked to one of the famous medicine person there. He said, yeah, very good. A lot of patients are there. And I sat in the room adjacent to him. So I could hear whatever conversation was going on. So a patient came and she was like, Dr. Saab, sadness of mood, not able to sleep, not able to talk, not able to feel good. And I was like, I'm about to get my first patient. But the patient did not come. Dr. Saab wrote Nexito Plus and went that patient back home. And then that is the case in India. Nobody, really refers to anyone. And probably that is why the reason is the way Indian system has been set up. The incentives are not in referring the patient, but to keep the patient with yourself. So our students who are entering MD should know the realities of the system also. That if you think that you become MD pulmonary medicine and all medicine guys are going to send the patient to you, that is not going to happen. They'll treat the patient themselves.
It's fine, sir. We don't want the case. In private practice, it's very different. We wanted the case with us. We wanted to be with us only.
Yeah.
We don't want.
In government setups, referrals would happen, but in private setups, even the corporate hospitals, I don't think anybody is referring to anyone.
But orthopedic,
yes, sir. Mostly, I refer for only one reason.
Dilip sir, orthopedician, gynecologist, and surgeon will refer to pulmonary medicine now. These three will refer.
Maybe, sir, the ortho people would not refer even to rheumatologist. They keep on treating themselves. They would never refer.
Maybe they don't like me, they can refer to pulmo, sir. So what I'm saying is,
if we keep talking about medicine, I think it is going to be 3 hours. Dilip sir, thank you very much, but you will have to take one more session individually for medicine. And I think there's going to be a talk about just staying with MD medicine versus going for DM. But all the best for your class. I think you have a class in waiting.
Thank you so much, sir. Thank you so much, sir.
I think
I'll just finish off the pointers alone, sir. Just 2 minutes. I'm not going to take much time. I'll just finish off what are the other just advantages because students are listening to it. Just I'll finish talking. So another biggest pros that we'll get is the patient continuity. So in many situations, you don't lose the patients. But here is something that you keep getting the patients over and over again. Once they like you, they're not going to leave you. So that satisfaction, patient continuity is very good, especially in medicine. Other clinical fields also have that, but medicine do have that. And obviously subspecialization, because most of the fields are end specialization, but here we have wide range of subspecialties. Even if you take a MD in a very average college, still you have another opportunity to have a crack at DM. So you can do somewhere in a good institution. So it's not going to be a big deal. I'm using the term good internist, even though there is a demand. So that is what I've been hearing every time, because if you look at my hospital, there are like 4, 5, 6 hospitals. Even though they have internal medicine in their hospital, still they refer it to me for various reasons. So still people keep saying in the phone that you have a good demand for internists, especially in the second and third tier cities. They keep calling us. Why can't you come and like start the clinic here? Why can't you come and do this, that, and all those things? And fourth important thing is, this is one area where you have a good opportunity in teaching and mentoring also students. So in many situations, I mean, it is a huge area. So I mean, even if there are 4 or 5 people join together, they can serve a wide variety of students. So teaching and mentoring options are very high in internal medicine. Then, of course, being an internist, because you're not doing any surgical practice, it opens up towards administrative skills in our hospitals also. So if you're good in your communication, if you're good in handling patients, if you're good in, maybe some of us, for example, many of them doesn't know, like I have a business administration degree also. The reason for that is because in my hospital, most of the time, they wanted me to take care of the administrative part as well. So you get a separate pay for that also. So if you take care of the administrative, and you can do marathons, awareness programs. I mean, these are like kind of gimmicks where you can pull the patient to the hospital. That's why we do all those. So generally, leadership roles also have something to do. And the question is why you should not take only 4 points. One first point is extremely high workload during your MDs. You have to manage so many duties depending on the institution you take. Very high workload will be there. And most of the time it will be very stressful because you need to read a lot. Not like other specialties. It's real that you read a lot. It's not like just you can manage with some basic concepts. It's like really you have to read a lot. And too much, you have to keep reading over and over again. So that's one important problem. And apart from that, maybe during internal medicine, you will not get any procedures to be done. Maybe you cannot regret after joining. If you want any procedures to be done, any interventions to be done, go for surgical fields. This is not the place where you're going to do too much of intervention. And fourth is, there is a high scope for medical errors in this field, and there is a high liability for suing also. Both only 2 fields that has this much liability is medicine and surgical. Any surgical field, and especially medical field in the future, because in our hospitals in the last 6 months, if you see, there are 4 cases have been sued. Okay, depending on like small errors, small mistakes, communication errors, like somebody has not seen. So I feel, and the last but not the least, looking at your surgical colleagues earning a lot, you will be burnt out mentally as well as physically.
Sir, I think we can change the name of session to medicine guy
Sir,
roast everybody else.
Now it is the time for the surgeons to chip in, gynecologists and surgeons and orthopedicians to chip in. But one thing that we all are very proud of for Dr. Dilip, and the love that he has received from the students throughout his career, he is a brilliant clinician apart from a brilliant teacher. He never left his practice. If you ever visit Chennai and the place he's working, you will understand his clinical skills. You know, you are a gifted clinician and a gifted teacher, sir, and never ever stop both of the things. He's been carrying both the things with grace, which is extremely rare. And those who don't know that he can balance himself on a cycle with his hand, that video we will share with you. He can also rotate a MacBook on his finger and he can take care of that. And if you visit his place and you ask him about any food, he will take you to the place. He will see that you have that food and he has enough knowledge about every item. That is something, the secret that we learned meeting him in Chennai. Dilip sir, thank you very much he is actually the best prepared, Vivek sir.
Yes, sir. Sir,
I
and
think the best
Dr. Dilip,
prepared.
yes, sir. And when Dr. Dilip was talking, now I was seeing that each of our clinician faculty was smiling because Dr. Dilip has shared a lot of tricks of the trade also.
Yeah, he has 5 favors point and 4 points in against. So over to you. Now we will take Zainab on the screen because Zainab is in between the recording. And next we'll take Jhanvi, because Jhanvi, a lot of students are writing your name, so get ready with your points. All right. So Zainab, what is the scope of radiology? One question that I see here is, do you miss being a clinician? This is the question, because people who take up radiology are getting, most of them are getting a clinical branch. So over to you, Zainab.
Yeah.
Dilip, thank you.
Thank you so much, sir. Thank you so much. I'll just take a leave.
Thank you, everyone. So when we talk about radiology, in the beginning you mentioned how this is a marriage. This is one of the marriages you will have out of many or one, whatever. So this is something where we get married, and radiology is one branch which I feel is an arranged marriage most of the time. Like how our parents say कि decent लड़का या लड़की मिल रही है कर लो. So that is how they take up radiology. It's very rarely a love marriage जहाँ पे लोगों को passion होता है about radiology. Even if I talk about myself, it was never something which I thought about until I got the rank, and I thought that okay, option hai, should I consider it? So that's how people end up with it. Now, if I have to talk about the pros and cons, one of the biggest pros is obviously the most famous, that is the work-life balance that you can achieve with it. The second one, the biggest in my opinion, is the flexibility you get and the kind of options that you have that radiology opens for you, where depending on what kind of work suits you, you can choose a variety of options even after choosing MD radiology, So if you have a surgical bent of mind, you want to do procedures, you want to have that adrenaline rush, IR is a very, very big field. It is booming, and it's only going to grow from now. So IR opens up a whole different kind of a path for you. If you feel that I don't want to do that, I want to be in diagnostic radiology, that also gives you a lot of job satisfaction, particularly if you are in a government or a private hospital setup. One of the limitations of diagnostic radiology comes in my opinion, when you go to a private center setup, where you have a focused ultrasound setup or you have a focused CT setup. That is the time you feel that the feedback is lacking, where you feel that you are not valued enough. So that is the only disadvantage, where I feel you will feel that you don't have that clinical satisfaction, which in a government setup, when I was at AIMS as a JR, as an SR, I never felt that, that I am not being valued enough, because ultimately it's your opinion which every clinician will come and take. We'll have radio conferences where we'll discuss the case. So you never get that feeling that you're not doing some clinical work. That is something which never comes into picture. It does come into picture when we work in a center, I must say that, in an ultrasound center. So that is one of the limitations of only doing diagnostic. The best part, I feel, is a mix of both. If you can manage both diagnostic and do some interventional procedure, I feel that gives you the best of both worlds, where you have good flexible hours of work, and you also are doing procedures, you are doing interventions. So there are many, many interventions you can do. You can do vascular interventions, which is core IR. Then there are non-vascular, which are ultrasound guided procedures. There are CT guided procedures, which we tend to do. And I've seen people who, just specialize in breast intervention, something as specific as breast interventions, and they build a whole career on that and are thriving, So there is a lot to be learned, There are a lot of opportunities once you get into MD radiology. So that's MD or DNB radiology. So these are the good things. The limitation side, as you all know, is the one that you are not managing the patient. End of the day, you are a doctor's doctor. You are the patient. It doesn't know, who your radiologist is most of the times. So that's the part which is the only limitation, I feel. Another thing is you do have to study a lot. Don't go in thinking it's going to be easy. Residency is a very long learning curve. It's a slow learning curve. There's a lot to learn. There's a lot to study. It's all new, because what we go in knowing about radiology is really not enough, and it's just the beginning point, and there is a lot of skill to be acquired. So as young residents, it will get overwhelming, intimidating at times. In the first 6 months, you don't understand what the heck is going on, but it's okay. You will eventually understand. So that's the thing, people should keep in mind. So you have to be willing to study a lot. There will be a lot of studying, more studying on the job rather than, with the books, obviously, like any other branch, but a lot of learning will go into it. It's a whole different skill set that we have to acquire. Apart from that, if I have to talk about DNB versus MD radiology, I think, again, just as Dilip sir said, this is another branch where DNB radiology doesn't put you any lesser, in terms of job opportunities, in terms of the pay. I think it's almost equal, and the job opportunities are definitely equal, So I know a lot of DNB radiologists who then go up, go and do a senior residency from another college, and as far as the knowledge is concerned or the skills are concerned, they are at par with any other radiologist out there. Same goes for DNB, I mean DMRD also. In radiology, we also have a diploma course, which is a 2-year DMRD, which I think one of the student was asking. So DMRD can also be done, and most of the times they follow it up with a 3-year DNB course, right? So that end of the day becomes a 5-year training course. So there I would advise a bit of a caution, because anyways you're doing 5 years, it's wiser to give in 1 more year of a drop and try to get a DNB or a MD seat if radiology is truly the one branch that you want to take, and you don't want to take any other options. So that case I would advise against a diploma, because then it ends up just being a longer course. As far as IR and radiation is concerned, there's one question about that. Obviously, there is radiation that you work with, but there are cutoffs which are laid down by the AARB, which are the guidelines that our government has. So you will not be crossing those. You will not be allowed to cross those. Obviously, there are measures we take. We wear lead aprons. There are other radiation protection measures that you take. So I don't think it should be one of the factors that could be discouraging you from taking radiology. Don't worry about it. You won't be allowed to go beyond that range of radiation exposure, which is not safe for you. So for girls also, I think girls have this worry or fear more than the boys because of the age that you want to do IR in. So you don't have to worry about it, is what my answer is. It will be in the safe range, and we monitor the radiation that you are going to be exposed to. Apart from that, it's always a rotational posting. Even if you're doing IR, it's always rotational, and it's not something that you would be doing day in and day out. There are always rotations that you will take into non-radiation interventions as well. So that way, that's not a concern. Another big concern is AI, I feel, where people feel AI is going to replace radiology, which I feel is completely nonsensical. Who is working on AI? We are working on AI, right? So do you think it is something that can replace us? It can't. It is always going to help us. Any artificial intelligence, we are going to use it to help us. I'll tell you what work is going on in AI today. It's all about radiogenomics now. For example, I see a lung mass, I'm going to use AI to do texture analysis and tell me, is it EGFR mutation? Is it ALK mutation? So that's the kind of work which is going on. Apart from that, another application can be, for example, I have 100 X-rays to report. AI will sort it out. It'll triage that, okay, these are the 3 which need your attention first. These can be seen later. So that's how AI is going to only help and complement us and never replace us. That's never going to be the case. And if I have another artificial intelligence, which I have only trained to find a pattern for me and give me another opinion, it's always going to be better, right? It's going to be better for our patients. So please don't be worried about this. The kind of work which is going on in AI is actually very, very exciting and very interesting. And those of you who are actually interested in basic science research or just research in general, radiology opens up a very, very exciting avenue for that as well. Those of you who have a research bent of mind, so yeah, this is what I had to say. If you have any other doubts, radiation oncology has nothing to do with radiology. It's a completely different course to do with treating cancer patients with radiation. It's not radiology. Nuclear medicine, another 3-year MD branch, which is correlated with, which is related to radiology, just that you use gamma rays, you use PET scans, SPECT scans. So it's also diagnostic. And now we have therapeutic nuclear medicine also, which is very exciting. The only limitation of nuclear medicine is the opportunity. It is more in, bigger cities where you will have multi-speciality hospitals. Otherwise, job opportunities are a little lesser in nuclear medicine. Apart from that, all the perks of radiology are with nuclear medicine. So that is all I had to say.
So Zainab has taken the lecture, the summary, the questions, and the answers. So thank you very much, Zainab. You can get back to your recordings.
Thank you so much.
Although Zainab,
to
if I may ask this, sorry, Apurv
Yeah,
sir, I think what Zainab talked about the influence of AI in radiology. We all have to see what happens, but I think AI is going to impact all the branches. And I mean, if I can just think of one scenario, say there are 10 X-rays to be reported, and if AI starts diagnosing it better than humans, and that is not only for radiology, for all the branches, I think maybe the number of people needed might go down. But again, I believe that medicine or medical sciences would be the last branch to get impacted by AI, because replacing a human by AI probably will happen in the end in medical branches. That is a risk that people would not want to take.
Yeah, I mean, what I have to say about this is, if you are alive today and thinking of taking up radiology, in your lifetime, AI is not going to replace you. That is 100% sure. And even if, I think of as a patient, if I'm going there and I see my report has been signed by AI and a human eye has not looked at it, I'm not going to buy it, right? Even if AI tells me he's the primary observer, even if I become a secondary observer, I have to be an observer.
But Zainab, what about if a study shows that AI is able to identify 90% of cases correctly and humans 70%?
Yeah, that's
Then what
okay.
will happen?
We both work, right? We both work in conjunction. It's always 1+1. It's never going to be human, AI minus human. It can be human minus AI or human plus AI. It can't be only AI, is what I'm trying to say.
Because I'll share something regarding psychiatry. I mean, there's a new software that have come up regarding CBT, cognitive behavioral therapy. And I was just using it, and the way it was answering the questions was so brilliant, so good, that very few psychologists can actually, do it like that. I mean, I see a clear-cut case of AI replacing at least some therapist in the future because it's so good and it's cheap. So, I mean, I hope what you're saying remains true. None of us is thrown out of our jobs, but
My take on this again, might be a bit more optimistic, but what I feel is, even if it does see the X-rays, it's good for me, right? But there are always going to be so many other things that we can now do. If it can do chest X-rays for me, it's good. I can go to CTs and I can go to MRs. If it can do CT/MR, I can do much more. So basically, human potential can't be capped, and we are the ones working on AI. End of the day, right? So I mean, in your lifetime, in our lifetime, if a student is watching this, I don't think this has to be a concern for opting for radiology, is what I can say.
that is for sure. I mean, this should not be a reason not to opt for any branch. I mean, whatever happens, we'll see, but that should not be a factor in taking up the branch. That I would totally agree with you.
So I'll be coming back to this, how robots are coming up. But before that, Dr. Jhanvi is the next who has an online lecture.
Sir, I have two questions first. I mean, the student want to know the.
Jhanvi has an online mission
अच्छा
class.
अच्छा sorry. Okay,
तो
sorry.
उसके बाद मैं बोलूंगा, फिर तुम्हारे 2 पॉइंट लेंगे.
ठीक है सर.
Jhanvi, over to you.
Thank you so much. I would like to say that I would like to start by saying that I don't think we would want AI or robot to either intubate us or give us a spinal or epidural. So my branch is completely safe on that aspect. Having said that, I'm a big promoter of anesthesia. I would like to state this fact. Anesthesia is a branch which most of us take by chance and not by choice. Many of us don't take it as our first choice. But I would give you a 10-year plan starting from now, why you're not going to regret this choice if you make it now. First of all, year one, right now, when you're applying for admission, you have the maximum number of seats in the entire country in anesthesia. So if you're the kind of person who wants to do a clinical branch, but for you, location of the branch and staying close to your family is more important, then I can tell you, guarantee, most of you can get a good anesthesia MD or DNB seat in your own city. Second thing is, once you pass out of anesthesia, so that is when we come to year 3, you have a lot of opportunities in anesthesia in terms of super specialty like pediatric, neuro, cardiac, transplant. But suppose you don't want to continue anesthesia at all. If you feel like I'm not comfortable with this branch and I want to pursue something else, we have two absolutely different things that you can do after an MD or DNB anesthesia. First is critical care. It is one of the most upcoming things, and you can definitely become an intensivist and manage ICUs in hospitals, which is a very handsomely paying branch right now. The second thing that you can do, which again is upcoming and there aren't too many experts in it, is pain medicine. So pain medicine is like the interventional part of anesthesia, where you can practice interventional pain blocks. And this is more of an OPD based practice. So you can have your own OPD as well as your own radiology center, where you can give C-arm guided or ultrasound guided blocks. Now, this was at year 3 when you're choosing your different paths. Let's go to year 5 of your practice when you plan to go out into practice. And this is the time when most of the other branches, with due respect, are actually trying to find patients or find jobs in institutions or corporate hospitals. And everywhere attachment is very difficult to get. But in case of anesthesia, there are so many jobs in anesthesia. As soon as you step out, like, people will actually be coming up to you and saying, please, can you come to my hospital? Can you come to my hospital also? Like, I'll tell you, 9 out of 10 times I have had to say no, that I've already committed to a case and I cannot make it. So if we talk about saturation related to this branch, there is absolutely no saturation. In fact, there is more and more need for anesthetists. We need anesthetists not just in the OT, we even need it for MRI, CT scans, wherever we have children, for sedation. We need anesthetists for standby in dermat procedures. We need anesthetists for OBS related IVF, all of these procedures. So you need an anesthetist practically everywhere and anywhere. So there are lots of jobs in anesthesia. And the best thing is that not just the saturation, you don't have to market yourself as an anesthetist. The minute you just make your business card and hand it out to surgeons or clinics and say that I have started practicing anesthesia, from that day onwards, your phone will not stop ringing. The next thing, this is year 5. You have just finished into year 5, out of which 3 years you were studying and preparing and 2 years into practice. Now let's talk about year 10. You have completed your MD anesthesia and 7 years of practice. And let's talk about work-life balance at this point, because you have been running around and making money and doing your practice. But now at year 10, you feel like I should have some kind of work-life balance. So this work-life balance is also something which is absolutely in your hands. If you like working a lot and you want to do a lot of cases, you can absolutely start your day at 6 a.m. in the morning and finish it at midnight. But if you want to give time to your family, you absolutely have the liberty to take cases only from 8 o'clock to 4 o'clock and let your surgeon know that I am not available for emergencies. So kindly do arrange for someone else to do emergency calls. And yes, surgeons are understanding. That is why I have married one. And they definitely will give you that option. If you're a good anesthetist, if you're someone that they can rely on, they will keep a standby anesthetist for emergencies and they will call you for the routine cases. Having said that, one more thing, in year 10, especially for females, this branch is very, very good, because there, as now in major cities, we have a lot of corporate hospitals coming up, and these corporate hospitals have work timings which are fixed. So you start your day at 8 and you finish your OT by generally 4-5 o'clock, after which no one will call you. And this is the best part about anesthesia. The time you leave your hospital and go, no one is going to call you back to have a look at your patient. Once the patient is out of anesthesia, you have shifted to the recovery room or to the ICU. Unless it is a major emergency or they want to get any details about anesthesia, the patient has now been transferred to the intensivist to manage. So that is one good thing. You finish your day with a calm mind and you don't have to go back to the hospital. Once a week, you will have emergency duties. Yes, this is a norm in every corporate or government hospitals to have once a week duty, which you have committed to. So you know that those days you're going to be busy. So these are all the pros about anesthesia. One pro I would like to add is for people who are looking to go abroad, but who feel that right now, after MBBS, I cannot go abroad because of financial issues or some other reasons. One of the easiest branches to go abroad is anesthesia. So the minute you finish your MD or DNB, you have to train for 1 year, you have to give a few exams, and you can easily get into UK. So UK has FRCA, which has a lot of jobs available. They really need anesthetists. And the second place is you can go to UAE if you don't want to go very far from India. So again, UAE has a lot of opportunities for anesthetists. US definitely is difficult to get in. So these are all the pros. So I've given you a 10-year plan, and I don't think anyone should not take up this branch if you're getting it. Now, talking about the cons, a lot of people tell me that, ma'am, we don't have any patient contact. We don't talk to the patients. As soon as the patient comes in, we put him off to sleep. And when he wakes up, he only remembers the surgeon. He doesn't remember us. Now, let me tell you, that may be a con for you at this point in time, but maybe 3 to 5 years down the line, when you deal with a lot of patients, you will actually see it as a pro, because that takes extra energy, extra efforts from your side to convince the patients. Nowadays, patients read so many things on Google, this, that, and come. So even a surgeon or a physician takes a lot of time to convince them about many things. In anesthesia, no one will read up much and come. They only know that you're going to put them off to sleep and you're going to wake them up. So that is, in a way, it is a pro. And if you feel that you don't have patient contact, don't forget you have to see the patient prior to surgery in pre-op evaluation. So that is the time that you can give to the patients, and those are your 15 minutes of patient contact. Second con that everyone feels is it's a dependent branch. You're dependent on the surgeon completely for cases and for time. Let me tell you, it is easier to form a team with the surgeon as compared to going out marketing yourselves and getting patients if you're taking other branches. So if what happens is, usually when you're training, there will be colleague surgeons who will be training as well. And when you all get out of the same institute, most of them end up forming a team so that you all can work together. If you find 2-3 like-minded surgeons, you can work with them and they will definitely keep giving you work. And you don't need to have your own setup. You don't need to have your own clinic. Like literally the day you get your MD or DNB passing certificate in hand, just buy a set of anesthesia bag with laryngoscopes, Wuji, whatever equipment you need, and you can start off your practice. You don't need to invest in anesthesia at all. Third thing is, ma'am, what about emergencies? Again, as I told you, emergency is absolutely up to you. To be very honest, in my branch, I see a lot of male colleagues who run around for emergencies because they can do so. On the other hand, female colleagues want to take care of house, family as well. So they happily refer the cases to their male colleagues saying that I will not be able to make it for the emergency. Can you go for it? So that is where you can manage. The next con that people say that anesthesia gives you less money. No, anesthesia gives you as much money as you work. So even if the surgeon is earning more for the case, maybe in a day he will be able to do 1 or 2 cases only. But as an anesthetist, you may be able to do 4 or 5 cases. So eventually the whole thing evens out. So you're making as much money as the surgeon. The only thing is the money is equal to how much effort you put in. So if you work more, you'll earn more. If you're not more about earning, then you can work less and save time. So that is another thing. And the last thing I want to add is MD versus DNB. Most of the DNB institutes for branches which have cutting like OBGY surgery, ortho, I'm not very sure about that, how much skills they give. But as far as I have seen, they don't give much of cutting. But in anesthesia, everyone is very nice and chill. And the departments themselves will give you from day one itself. They will give you mask holding, laryngoscopy, spinal, epidural. So whether you take MD or whether you take DNB, you are going to get enough skill set at the end of 3 years. So I don't see much of a difference in both of them. The last thing that I would like to add, 2 last things. One is, if you're planning to take up anesthesia, but you have no clue about the branch, please go and attend with an anesthetist or in your own institute for at least 1 week under someone, so that you have an idea what exactly is done in anesthesia, because some people find it a little boring. Let me tell you, you will find it initially boring, but when the case is totally your responsibility, that is when you will be very vigilant, and that boredom will definitely go out of the picture. So spend 1 week under an anesthetist to see what all they work and if this is the kind of life you would like to live. Second thing, if you do end up taking anesthesia, please do subscribe to the Conceptual Anesthesia app. So this is an app that we have for MD DNB students, and it will help you prepare from day one itself for your anesthesia residency. And that's it. So I think I've covered most of the points.
Jhanvi,
I can say this from this. I just want to say one thing. Anesthesia people, daughter Jhanvi, are most chilled out. Mother, hats off to you. Even in this
Gaurav sir, you have multiple reasons to say so.
I know. My wife is an anesthesiologist, and I can say like, I sometimes I feel guilty why I didn't take anesthesia. Sometimes she makes me
Actually,
feel that.
even Dr. Amrit tells me that he told me when I was taking up a branch, he said if I had a choice, I would go back and do anesthesia. So that was the reason I took it up.
So, ma'am, you have got two potential buyers for conceptual anesthesia app now. Gaurav sir
Yes.
and Amrit sir.
And
In
Dr.
fact-
Jhanvi, sir, Dr. Jhanvi has made such a convincing case. I think anesthesia is going to get a very high cutoff this time.
Vivek
All
sir,
the cons she has converted to pros.
that is what negative को भी positive बोल के मारा उसने कि ये
हाँ।
negative है, तो ये भी फायदा है.
ये
I think Praveen, you wanted to speak something. Universe boss, you
नहीं
wanted to
सर,
make...
देखिए ऐसा है ना कि हम लोग तो ब्रांचेस के बारे में अच्छा से बोलते हैं सब लोग, बिकॉज ऑल ऑफ अस आर इन लव विद अवर ब्रांचेस. बच्चों के क्वेश्चन अलग होते हैं. उनका क्वेश्चन है कि मैम एमडी करने का पैसा कितना मिलेगा, जॉब कितने की मिलती है, अब बताओ कितने की मिलती है. मतलब ऑल ऑफ अस शुड एक्चुअली टेल देम बिकॉज दिस इज व्हाट दे आर रियली कंसर्न्ड अबाउट.
Yes.
But before Jhanvi answers, before Jhanvi answers, she said a very nice thing, and that is something that people tend to forget or overlook. That finally, what amount of money you make in any of the branches is dependent on you.
Yes.
अब आप लोगों को लगता है कि रेडियोलॉजी 5 लाख, ऑर्थो 4 लाख, ऐसे ऐसे कोई रेट लिस्ट कहीं पे नहीं लगी हुई है. What exactly you are doing, what setup you are running, whether you are comfortable running your own setup, whether you are okay taking care of managerial duties, whether you are open to opening an inpatient setup, all these things are finally going to determine the money that you make. ब्रांच और पैसे का कोई डायरेक्ट रिलेशनशिप है नहीं.
गोगा भाई साहब ने कहा तो पंच लाइन थी ना कि बंदे पे
वही
दम
बात
होना।
कर दी तुमने. 1 घंटे बाद
हाँ,
same
बट
बात
सर
बोली
इसके
आपने.
बाद एक सेकंड क्वेश्चन ये आता है, मैं स्टूडेंट्स कहते हैं कि यार इमीडिएटली एमडी के बाद एमएस कर कितना पैसे की जॉब मिलती है. सो जानवी, कैन यू आंसर दैट?
Yes, so I would like to give a range for this because it depends on where you are located as compared to South or Mumbai. There is more pay in Delhi side. So the starting range would be 1 lakh rupees, 1 to 1.2 lakh rupees. And this is immediately post MD-DNB. And it even in Delhi, it can go up to 1.3 to 1.5 lakh rupees depending on the institute that you join. Government institute, central government pay around this scale. If you talk about like government hospitals, municipal corporation hospitals, they are slightly lesser, maybe somewhere around 90,000 to 1 lakh. But let's take an average of 1 lakh as soon as you get out. This is a fresher. If you go 3 years post, after that in anesthesia, you can earn anywhere between 1.5 to 2 lakh rupees for a job. So this is a job. But if you start freelancing at that point in time, again, the sky is the limit. You can earn anywhere between say 2.5 to 5 lakh rupees, depending on how much you run around. So freelancing again depends, is totally effort dependent. If you look at corporate hospitals, let me give you a cap also for those of you who feel like kitna kama lenge, chalo corporate mein professor level pe pahunch ke bhi kitna kama lenge. So that would be somewhere around 4 to 4.5 lakh rupees or 5 lakh rupees, itna. But there are some private hospitals which will have like their prime anesthetists, which now this is saying too much, but this may even go up to 10 lakh rupees or 12 lakh rupees as head of department. All this is per month, but all this is at the age of 50, 55, 60.
Dr. Jhanvi, another thing that I will say is कि, I mean, what I've seen is lot of anesthesia people come together and they provide ICU services to the smaller hospitals.
Yes.
Right? And that is one, I mean, see, this is how entrepreneurial you are. If you want to get
Yes.
into all those things, if you want to tie up with the hospitals, then effectively there is no limit. फिर आप कितने hospitals का जा पाते हो वो होता है. Limits जो डॉक्टर जानवी बोल रही है वो jobs की हैं. She is talking about a corporate hospital जहाँ पे pay structure है. Right? So this is something
Yes.
you have to understand that आप equate मत करिए branch को पैसे से.
फाइनली 1 घंटे बाद वही बात होगी ना सेम.
हाँ, नहीं बात तो हमेशा वही है सर. वो बात तो गोगा सर ने पहले लाइन बोली है. Zainab, if I may come back to you and ask the same question, that a lot of students take up radiology for the reason that it pays very well. So I have two questions to you. What is an average paycheck that a radiologist can take back home after the MD is over? And secondly, is there a ceiling? Is there a ceiling in radiology?
Yeah, I mean, I agree with Dr. Jhanvi here. Plus, I feel कि अब session बंद कर देना चाहिए because she has convinced everybody कि
सब anesthesia ले लो.
अब खत्म करो और कुछ लेना ही नहीं है. So basically, I think the pay here will depend on what kind of a setup you are, even in radiology. Once you finish your MD or DNB, अगर आप एक hospital setup में हो, government hospital setup में हो, then it's a standard faculty salary. Like in Delhi, it'll be somewhere close to 2 lakhs per month. South में थोड़ा कम होता है 1 lakh के side में. So that's the government salary. Even as a faculty, there's a cap and you don't go beyond 2.5, per month. So that's for government. In corporate, the pay for young radiologists is higher. That's why people have this misconception कि radiology में आपको ज़्यादा पैसा मिलता है. The starting pay in radiology is higher and then it plateaus. That's one thing all of you have to understand. So the starting pay will be close to 3.5 to 4 lakhs if you are in a good corporate private setup, and it kind of plateaus there. The highest you will reach is 10 lakhs, 8 to 10 lakhs, and that will be again in similar to anesthesia in your 50s and when you worked in a hospital for a long time. So that range in private for a young radiologist is what is attractive. If you have your own setup, your own center, then sky is the limit. Then as many patients as you can do, but that is a little investment heavy. That's the only thing, because these machines, ultrasound machine is a little less expensive, but to open your own CT MRI setup will take a lot of capital. So you can't do that just fresh out of your MD. You will minimum need five years of practice outside to understand the system before you open a full-fledged center. But if you have that in place, then there is no cap. Literally, you can earn as much as you want, and depending on the patient load, the pay keeps increasing as you move to the periphery. That is something which is definitely true for radiology. If you are in Delhi, you will not earn as much as somebody who's in a remote town in Rajasthan or Gujarat. That is something which here, the as close you are to the metro, the lesser will be the pay. That's how radiology works.
Right.
Demand increases in periphery.
But then we have to remember that running a center is akin to running a system. I mean, students at their age do not realize this, but then you have to talk to the doctors, ensure that you are getting patients, and then there are many things involved there.
Another headache for radiologists is PCP and DT, which I can briefly talk about. If you feel that I can open my ultrasound center and I'll be set, you will not be set. You will be, there is a lot of harassment, if I can call it, in our country, as far as PCP and DT, lots of record keeping goes into play, and there are many, many things you have to be very careful about. So most of the times when you're fresh out of MD or out of SRship, you feel कि नहीं, इस झंझट में अभी नहीं पढ़ना. Let me first understand the system, So that is why it is good. It's a good idea to first work in a center or a corporate and understand how things work, and then go on to develop your own setup.
So if I may suggest students, if you got a very good rank and you can get anything, don't take radiology just because you can take it. I mean, it's a great branch, of course, but as we have said multiple times that if you always wanted to become an orthopedician or medicine person or surgeon and you got a great rank, please stick to what you always wanted to do if you were that clear in your head. Otherwise, if you were not clear, of course, radiology pays really well and pays really fast. That is one thing. But if you really like one branch, please stick to it. Medicine is a long game. I mean, you'll continue to practice till you are 70 years or 75 years. Ensure that you are doing something that you love.
Yeah, if I can summarize in last one line is that if you have a surgical bent of mind and wanted to be a surgeon, don't take up radiology. You will regret it. If you have a MD medicine kind of a mind and you are confused now that I'm getting both medicine and radio, which I feel is a very big confusion for most students. If you like studying, if diagnosis making fascinates you, go for radiology. You will love it. If managing patient gives you the kick, don't take radiology. So that is how simple it is.
I will just like to give you an example. When I had to choose the branch, I was between these two things. I really wanted to be an orthopedic surgeon, and I didn't regret that after about 19 years of taking ortho. The difference is in radiology, you start earning early. In ortho, you go slow. But in a surgical branch, you cross it and there is no stopping. It will go beyond the screen. So this is something you should learn. But then it's a different age. It's a decade or more. Then you do that. Dr. Praveen, this session is about students going for the branch. I think Vivek sir has got a beautiful presentation where
Right.
he will tell actually what do you expect, right? And I think then the surgeons and then Dr. Anand and everybody else can interact that what are the options we are getting at different rank, right? My work was 4. I had to get Dr. Dilip sir back to the class, Zainab to recording, Jhanvi to class, and I had to say bye bye to all of you. Now Praveen sir and Goga bhai and Sparsh sir will carry on with Vivek sir. We will like to have an analysis of what Vivek sir has prepared. I will make a small video about taking up ortho today with robots and everything else and post it in the app on YouTube. So I will take your leave. Thank you very much. Over to Vivek sir and Praveen sir and Goga bhai and everybody else. Sabko namaste. Thank you very much. Bye bye.
Thank you. Thank you so much.
Bye. Bye. Sir Vivek sir, you are mute.
Vivek sir, you are mute, sir.
Thank you, Apurv sir. What I've done is I've tried to compile the data from 2023 and 22, last 2 years, the round 1 cutoff for MDMS and the final cutoff for DNB, the ranks. There may be some few things may not be absolutely correct, but what I like the students to is have at least a look once. We'll not go through this in detail right now. Individual branch-wise subject specialists can take it over. And the video will be there on the YouTube as well. I'll share the screenshots. Otherwise, also you can take a screenshot right now also. This is the round 1 for last year. Have a look, please. For 2023-22 category wise. And I have picked 15 branches, top 15, 16 branches that you should definitely know. Similarly, there is a second screen also you should have a look at. This is for the DNB. And it is not round 1. I'll just strike it off. This is not round 1. Please remember. This is the final cutoff. Right. So have a look at this and I'll share the screenshots. So friends, kindly go through it once. Take a screenshot maybe right now. Or you can watch the video later. Dr. Praveen sir, next you will be discussing for psychiatry, or should Dr. Amrit sir, I think, should come first, right?
Sure, sir. Sure.
Dr. Amrit sir.
Hello guys, good evening. Thank you so much, sir. So I will just give a little overview of what students have asked me as well over the last few days as to how to choose should they be taking surgery or not. Usually there are 3 kinds of people who opt for surgery. One are those whose parents tell them they have a setup, so it will be easier for you to get started, to get patients. Those are 100% justified. So if you are falling in that category where you have a parental setup, you should definitely take a surgical branch, general surgery, orthopedics, or any surgical branch. Second kind of people are those who didn't get the rank that they desired for a radiology or a medicine or a pediatrics, a little, lower rank around the late 9,000, 10,000, 15,000. They're like, sir, I'm not getting, I want a clinical branch. Should I take surgery? And the third kind of people are like me. They get good ranks. I had gotten 280 in my time, and I was getting everything under the sun, but I opted for surgery. So if you are opting for surgery, then definitely it is something you are never ever going to regret. The ones who are in between, who are taking it because the rank demanded it, that is a little iffy situation. So I'll tell you whether you should or you should not and what you will expect. The most popular question is, will I get hands-on? Will I get hands-on in MS or DNB? And does it really matter? So it does not matter as much as you perceive it to be. Of course, everything matters, all experience matters, but we are giving it number 1 priority. As a surgeon, I can tell you that, okay, I was in a very busy institute. I was in KEM hospital. I must have done so many hernias and abscesses and open appendectomies. Really speaking, none of that I am practicing today. So if you are going to super specialize, then your core training has to be a very basic training, especially in terms of hands-on experience. What is more important is the environment. At least for today's generation, it should not be a very toxic work environment. So if you're in a place where every day you are not getting to sleep, not getting to eat, and the seniors are toxic, you will get frustrated. So when people ask me, should I go for the busiest institute versus an in-between institute, I always say take an in-between institute. So which is why I also say taking DNB is not a bad choice, because, okay, Dilip sir said the same thing. You will get less exposure, but you will get time to study, which you may not get in a very busy central institute. And if you can't study, if you're just operating on cases or seeing patients at a spinal level, are you really learning? for a surgeon, it's more important to know when to operate and when not to operate. Apurv sir will second, every surgeon who is here in any surgical field will second this. You need to know when not to operate. That you will only learn if you have good seniors in a good environment where you can read. If you are going to spend 3 years only operating, cutting, and by the end of it, you will be frustrated कि okay, बहुत कर लिया लेकिन सीखा कुछ नहीं. So that is one important thing you should consider. Don't run behind cutting. It is a little unpopular thing for me to say, but yes, it does matter because whatever I learned in my 3 years of residency, what I truly value today is what I learned how to operate, से ज़्यादा more when to operate and when not to operate. Surgery is an ever growing field. There is so much technology, even if in 3 years, and in 3 years, nobody is a proper surgeon. Unlike anesthesia, Dr. Jhanvi was saying after 3 years, you can go into practice. No surgeon goes into practice after 3 years of residency. You will either go for work experience as an SR, lecturer, get some confidence. That is when you are truly learning. That is the true hands-on. Or you go super specialty. Agar super specialty karni hai, then don't worry so much about how your MS is. Especially if you get time to study, then you will crack your super specialty in the first go. And what you learn there will become your practice. So that is how you should kind of choose your branch. How life is going to be. Is there going to be work-life balance? Another question. Really speaking, for a surgeon, any surgeon who is having any kind of emergency practice, work-life balance is tough. I am not going to deny it. Most of my peers, whether they are doing laparoscopic surgery or urology, they are working Monday to Sunday. So it's not very easy for them to get, take offs. That is a downside and you have to be okay with it. It's very difficult to have a practice where you will work Monday to Friday or Monday to Saturday 9 to 5. That really doesn't work. Dr. Raina will agree with the same कि कभी भी जाना पड़ता है and कोई ना कोई surgery में emergency कभी ना कभी आती है. So that is a downside. Money can be good. Effort to reward can be amazing if you do super specialty or you do a very niche branch. Like I am trying to do bariatric surgery. As of now, there are not many people doing bariatric surgery. So like that, there are branches which are not very saturated where you can create your own in your area. But if you're looking to practice in a metro city, then you have to do super specialty. That is one of the regrets I have. I never did a super specialty. So if you get a chance, you should definitely do an MCH and then start practice in the city. So these are some pros and cons. Don't run behind cutting. Spend time to study. And another thing which is very underrated in India is research. So whenever you are after finishing your education, applying for a job, what they see first is not from where you did your MS. What they see first is your work experience. So if you've done some work experience after your MS, and they see if you have any research publications, which unfortunately many people in their surgery residency don't have. If you have these things, it will hold as much weight, if not more, than just doing MS from a very reputed place. So these are my two words. I feel it should, give you a little balance on how you should choose the place, whether the branch is meant for you or not. And whatever it is, if you take it, you are not going to regret it.
Dr. Amrit,
Yes,
there
sir.
are two questions which are consistently coming in the chat box. Number one, for a female medico, what to think about surgery as a career option? And number two, what about 6-year integrated courses?
So the first question, actually, sir, I was discussing this with Dr. Jhanvi myself. In metro cities, females are very much okay to go for general surgery. Only thing is, after general surgery, their main focus of practice should be something which will be a little more female-centric, or where the masses will be okay to go. So going by something like a urology, a lot of male patients would not be okay visiting them, like how most men or most women are not okay going to male obstetricians. So it is similar, but yeah, there are a lot of branches in surgery where females would be preferred, like breast surgery or plastic surgery. So definitely going for general surgery is not at all a taboo anymore, especially in metros, and you can have a good practice, but you only need to focus on your final subspecialty that you are going to practice. Or you do plain general surgery. For plain general surgery, there is ample work in the market. So that is the first one. The second is 6-year integrated courses. Sir, I will tell you very honestly, I feel going for a 6-year course means saying for 6 years I'll do neurosurgery or cardiac surgery. I feel it's like committing to a marriage. It is too much of a commitment. And if you don't like it along the way, you can't change. So I would strongly advise against it. And that's why those branches go at a much lower rank, because people are very afraid to commit so much. I would also be afraid. After general surgery, you can easily decide, and super specialty seats are not very difficult because there are not many people who give the exams. So it is very manageable then.
Wow, thank you, sir. Students, any other query for surgery? Sir, DNB versus MS, briefly, if we can discuss it again.
Sir, whatever similar points as Dr. Dilip said, DNB hospitals are absolutely okay to take, especially if they are renowned hospitals where there is a good patient turnover. Little less exposure is okay, but you don't have a bond. Patients are not going to be aggressive. Definitely not the quality of patients. If you are eventually going to go into private practice, these are the kind of patients you want to be treating. So you will get the correct hang of communicating with these patients versus in a busy government hospital where you are spending 30 seconds with the patient. That's not good patient communication. So absolutely okay to do DNB. If you don't get enough hands-on, if you feel I didn't even know how to do a hernia properly, spend some months in your SR ship and get that experience covered. No problem. Or you do super specialty.
Thank you, sir. And sir, if 2-3 points we have to look at for choosing a particular college for surgery, what should I consider from a student's point of view?
First and foremost, I feel you should not go too far away from your home, because in surgery, residency can get really burdening. You can get frustrated. There are toxic, people in the department. So you need some comfort, some support. If you have a day off and you get a chance to go home, it would be a big relief. So pick something which is close to home. Don't just go behind the name of the institute. Look at how the teachers are there in the department. Department faculty matters a lot. That they should be a little more accommodating. So that is another. Third is it should be a place where you have rotations. So in 3 years, it should not be that for all the 3 years you are under the same teacher. You should have rotation in different fields, in different head of departments, so that you get more exposure. And there should be some time to study. So it should not be extremely busy. वरना पढ़ने का time नहीं मिलेगा.
Wow. Thank you so much, sir. Students, I can also advise you one thing, whichever branch you are thinking of. See, it is your career which is on the stake, on the line, and you have prepared so hard for it. What I'll suggest is take out 1 or 2 days from your life, go to your parent college or some other nearby medical college, meet from juniors to seniors, JR, SR, assistant professor, professor, HOD. Let them share their experiences with you. They will tell you pros, cons. Some may be highly satisfied with the branch, some may be highly frustrated, but that will help you take an informed decision. So I think this you should try. Definitely, you have a lot of time left, and that will give you a more sense of clarity in choosing the branch. Thank you so much, Dr. Amrit, sir.
They should visit some practitioners also. It is very important to visit a practitioner who is practicing in their area, because sometimes when you go actually practice than private practice. So if it is feasible, they should visit a private practice also.
Yes, and on behalf of Team Cerebellum, I can invite everyone to the clinics of our practicing clinicians. You are most welcome. Come down to us, and definitely we can discuss. Right, sir?
Yes, absolutely. I have been telling all those who have been chatting with me on my WhatsApp, I've been telling, come and see the practice, see how the clinic is being run, what are the day-to-day challenges that we are facing. So that gives a very good insight of what lies ahead
Thank you.
10, 15 years down the line.
Thank you, Gaurav sir. Since Praveen sir is not here, Dr. Raina Chawla ma'am, this is the best time to come on screen. Ma'am, please take over.
Okay, so hi everyone. I was just listening patiently to everyone, and so as I think for OBG, most students who want to take OBG know it from the very beginning. कि हमें OBG लेना है, because and this has come down over the years. The number of people wanting to take OBG has gradually come down. There are many reasons behind that, but I'm very glad that students these days are very woke. When we were interns and when we had to choose our branch, I had never given so much thought. I just knew कि मुझे OBG अच्छा लगता है, I'm going to take OBG. There was no second thoughts to it. But now I'm so glad that there's so much awareness, and all of you are able to discuss this, and every aspect of this is discussed. and I've been busy on Telegram and WhatsApp sorting out issues of different students the last few days. So what I feel is the commonest question I have got is cutting. Will I get cutting? And Dr. Amrit has covered this in a lot of detail, and I keep saying this: cutting your hands on is not the primary thing. You need to put that at one of the last points you're looking at. So cutting is important to some extent, but it's not your first criteria. You learn along the way. So skills, when we talk about learning skills, um, it's not going to be done in those 3 years. It's a continuous process. Of course, you will get some cutting exposure, some less, some more, depending on where you're doing your post graduation from. And so it's something which I am learning till date. If there's so many surgeries which I am still not comfortable doing, and like nowadays robotic has come in, and other things are also there. So it is a continuous process. So don't look for cutting as primary. The second thing which I keep getting asked is, what about work-life balance? OBG is very toxic. You don't get time for family, you don't get time for yourself. So there is some truth to this. Toxicity in a college or is something which I think again is very subjective. It changes from year to year. It depends on who your seniors are. It depends on you yourself. And I feel toxicity is something which you yourself can change. So I want all of you to do this. Whatever you take, whatever you join, whatever branch you take, please make this promise to yourself that you will be a good colleague, a good team member, a good senior, a good junior. And gradually toxicity will disappear from the system. Now, I have honestly not encountered toxicity, and I have worked in many medical colleges, and now I'm working in the corporate setup. So I think it's something which is very subjective. But yes, if you feel that is going to play a role, and some colleges are known for it, do check out and speak to the people working there. That's one thing. Another thing is, okay, so before I go more into OBG, what are the pros? For those of you who I saw many messages on YouTube, whether we need to take OBG versus ENT, OBG versus pediatrics. So OBG, remember, is a very good mix of a lot of things. So those of you who are confused, कि OBG lena hai ya nahi lena, remember OBG is a good mix of medicine, surgery, radiology, a bit of pediatrics, and it's everything in one. So it's you get to see so much, you get to operate so much, you get to and it's a lovely branch otherwise also, because and the reason I took up OBG was it just brings so much joy. I don't think any other branch, honestly, I think this is something which everybody would agree with, is itni khushi kisi bhi branch mein nahi milti, and you have very, very less morbidity, very, very less mortality. It's more of bringing joy into the world. Of course, there's a lot of stress and anxiety on which we have to take to reach that joy, but I think in the end, it's all worth it. So OBG is it's a nice mix, and if you're confused, just think that it's a good mix of everything. Of course, there's a struggle. The first few years are going to be difficult, but eventually maybe I think after 5 to 10 years, you can reach at a place where you can achieve a good work-life balance. You can decide to do only gynae, or you can super specialize and you can have your 9 to 5 job if you do fetal medicine or IVF, or go into only laparoscopy or onco. You have your fixed, you don't have to deal with obstetrics at all. Many of my colleagues are doing that. They don't do obstetrics and they're very happy. That's one aspect to it. The second, I was just writing down the doubts. The second common, one very common doubt I get is, can the guys take up obs and gynae? A very commonly asked doubt. And I have so many friends who are male gynecologists, and they're all doing brilliantly well. However, in some parts of the country, there is a stigma associated mainly by the patient. The patients do not want to show, especially for delivery or the obstetrics part, they will not go to a male gynecologist. That bias trickles down to the corporate sector, like the hospital I work in. Okay, and it's very sad to say this, but the administration didn't allow a male SR had come for an interview, and they didn't allow him to join. Although I had given brilliant recommendations for him, they said no. Because I practice in Faridabad, which is a little outside Delhi, and so Delhi, Haryana, Punjab, Delhi I would not say, but yeah, some parts. they will not, it will be difficult for a junior male OBGYN, especially for obstetrics. But in the south, in Maharashtra, in Bengal, in Orissa, I know so many male gynecologists who are doing really, really well, and there's no bias whatsoever. If you're good at your job, if you're passionate about it, my suggestion is please take up obs and gynae, even if you're a male, a guy. And then another question, which was earnings. How much do you earn? So if you do super specialization, you earn quite well. But the earning curve, as Dr. Apurv said, for a surgeon is slow in the beginning, but it will go beyond the screen. So that's the same thing I would say for any surgical field. It starts slow, but you will end up very, very high. And just to end the whole thing about OBG, I think it's an evergreen branch. There are 300 plus gynecologists in Faridabad, and nobody is sitting khali. Everybody has work. So you will have work. It's not like you will be doing nothing and you'll be struggling to find jobs. You will find something to do. And it's a beautiful branch. I'm not a good marketing person as Dr. Jhanvi, but I think it's something, if you really feel you need to, it's a subject, it's a beautiful subject. If you want to take it, and I'm there to help you out. And we also have our conceptual OBG, so you can connect with me if you're interested in taking up the subject. Thank you.
Dr. Raina ma'am, one very innocent question has come. I'll answer it in partly, then please take over. A very innocent question. Is gyneops branch very hectic? So I'll just start by answering this line. I tell the students to remember data in PSM. At any given point of time, 3% of Indian population is pregnant. That translates to around 4.2 to 4.3 crores. So now you can take over. Is gyneops really hectic?
I feel hectic, this word hectic, if you enjoy your job, nothing is hectic. You will enjoy what you're doing. And I feel all branches are hectic, especially in the beginning. Your 3 years of post-graduation in any branch, at least in most clinical branches, would definitely be hectic. That hecticness will continue for a few years later, but then it will reduce down. But somehow I don't like the word hectic. I think if you enjoy your work, nothing is hectic.
Absolutely, ma'am. Absolutely. So, ma'am, also there is one more query. A lot of students are worried about medical legal cases. Are there way too many in obs gynae?
Yeah, so as I think Dr. Dilip had mentioned, Dr. Amrit also said, this is a major problem, and many of my colleagues do face it. It does get stressful. Remember when complications do happen, and they're known complications: postpartum hemorrhage, amniotic fluid embolism, and somehow when a high-risk patient comes, you explain everything and nothing happens, everything goes fine, and you explain everything, but the sadly the complications happen in when you least expect it. And sadly that involves a baby and a young mother. So that anguish, the grief which hits the family passes on, in their venting their anger passes on to the doctor, and it is a very stressful situation. In fact, if Williams, which are standard book for obs and gynae, the first chapter says, it's an American book. The first chapter starts with that on an average, an American gynecologist is sued 1.75 times in his or her lifetime. So that is a real problem in the field.
We are still okay with getting sued. The problem is in India there's violence directly. So that is something, I mean, at least in America people sue. You can fight that in the court, but in India it's another problem.
So you have to practice very carefully. Every case we do, even elective, small, minor surgery, we consents, documentation, everything has to be proper. To check it, cross-check it, talk to the patient yourself. Don't leave it for somebody else and in turn to do it yourself. Do the counseling yourself, talk to the patient, tell them what all can happen. Then it's their choice what they want to do.
But Raina ma'am, I think again this is something that is applicable to almost all the fields. And probably when it comes to OBG or pediatrics, maybe the emotions run a bit too high. But then, I think that should not be a reason to opt or not opt for a branch. Because if you're becoming a doctor, medical legal cases are reality that you just cannot do away with.
Yes. That's what I'm saying. The passion should come from within. If you want to take this up, these things should not deter you.
Thank you so much, ma'am. Thank you so much for your insight.
Sir. Thank you.
And Dr. Praveen sir, I think now you should take up psychiatry. You can start with a question a student has posted. Do psychiatrists themselves suffer from any particular disorder if they practice it for years and years? Please,
Yes,
sir.
sir. That is the age-old question that if psychiatrists themselves develop psychiatric disorders. Okay, क्या बोला गौरव सर आपने?
We can vouch for it.
Right. Just a second. So I'm just trying to see the comments also so that I can answer if any new question crops up. Okay. All right.
Do you do, sir, Dr. Praveen sir, do you do self-psychotherapy?
No, sir. So, sir, just to answer that question, I mean, it's a very important question because even doctors do have certain misconceptions about it. So, the first of all, we have no data to say that residency in psychiatry would increase the chances of you developing any psychiatric disorder. That said, there are two things which are hypotheses as of today. If somebody is having a psychiatric illness to start with, say somebody is having anxiety issues or somebody has had depressive episodes in the past, and Dr. Ankur is there with me, he's a psychiatrist from one of the top colleges. Ankur sir, I would definitely want your opinions also. There is some data that says that if somebody had anxiety issues or depressive issues, the chances of that person becoming inclined towards psychiatry increases a bit. So that is something that we do have for sure. But psychiatric residency causing a psychiatric disorder, there is no evidence for that, and I don't think there is any reason to believe that. Second thing that students say is that you are listening to all these stories throughout the day and you get very impacted by it. The answer is again no, right? After some time, first of all, you get totally numb to all those things, and secondly, I mean, it's like the first time you make a death certificate in a hospital during your internship, you feel really bad and you feel really moved. But then after some time, you see so many cases, so many things happening, and then you become used to it. The same thing happens in psychiatry. After talking to a person who is depressed or who's anxious, you don't really become depressed or anxious. That is a part of your learning. That is a part of your training. So to answer your question in one line, that do you tend to develop psychiatric disorders because of the practice of psychiatry? The answer is no. Are you more likely to diagnose yourself in case something happens? The answer is of course yes. I mean, if I start having disturbances in sleep, and if I start feeling sad all the time, if I start having obsessive thoughts, perhaps I would be the one who would immediately realize that okay, something is wrong. Ankur sir, you want to chip in? You want to add to this?
Yes. Good evening, all. Definitely, sir, you said absolutely correct that there is no increased risk as data suggests. But I feel that if you are more involved in psychotherapy and when you empathize, at that time there are chances that, but that part is usually not done by psychiatrists. And if you are doing psychotherapy up to a limited period, then it is vast away. So I don't feel that it's going to affect. But I felt myself that after my MD psychiatry, I am better emotionally, more stable. I could know that how to handle all these stress when I am advising my students and other persons. I started implemented on me, and I felt myself a better person. It's my personal opinion.
Yeah, so sir, although the data is not there for that either, that psychiatrists become better person. So I think if we look at the larger picture, sir, I don't think residency per se or practicing psychiatry per se would either harm or make you better. I mean, there's some case still for becoming a bit better in handling things, but I think we don't have any data to at least back it.
Definitely.
Sir and Praveen sir, a common question, say for example, somebody as an outsider would be really keen for you to explain about is that doctors do understand it, but what I find is that a lot of times there is a lot of hesitation coming from their family. See, the kind of questions that people are raising may not be directly their questions. It is just that parents at times are just not too supportive of their wards picking up this kind of a branch. तुम दिन भर ये सुनोगे तो तुमको भी असर हो जाएगा, something of that sort. So if you can just share those some words of wisdom over here, I mean, which can be shown to the previous generation by the future psychiatrists of the country, I think that is something which is going to be helpful.
So that's very true. In fact, my mother was also against me taking up psychiatry. I'm not sure about Ankur sir, but my mom was not happy when I took psychiatry, and I think that is the case with the vast majority of parents. And I feel that it is more so with the doctor parents. Sir, we have to understand that the field of psychiatry has changed a lot in last 20 years. I mean, if we go back 30 or 40 years in time, we did not really have any pharmacotherapy. We did not have anything. Mental hospitals were everywhere. So a lot of people carry those images in their head that this is how psychiatrists practice. Nowadays, the practice of psychiatry is all in the small centers, in the clinics. So probably some stigma we carry from the previous years. But as far as stigma is concerned, I think it has gone significantly down in the last 10 years. Thankfully, all these celebrities are talking about psychiatric disorder. The society in general has become more, accepting of psychiatric illnesses. At the same time, some stigma remains there, but sometimes people are worried that they would not get patients. Now, please, look at the data. Almost 10% of the population has one or other psychiatric illness. It might be a minor anxiety or depressive issue. So 10% is a huge number. Out of that 10%, even 1% of people seek help. You have a huge number. So this thought that psychiatrists don't get patients, or another thing is they don't do well financially, that is totally nonsense. There is no substance to that. All my friends, all my colleagues who went to small places like Allahabad or stayed in big cities like Delhi or Mumbai, everybody is doing great. So that whole anxiety is probably a legacy issue, because that was there a couple of years back, not so much anymore.
Rather, it is the most promising branch now. It is the most upcoming branch with more and more people opening up to these things. I think this is and I believe it has a very good scope for if somebody wants to shift outside India, that also has a very good scope, I think.
Yes, sir. So going out to UK or to Australia, all these places is pretty easy with psychiatry. I think for UK, NHS is anyways opening up for all the clinical branches. So that is there. So if I can talk about the cons, I would very strongly advise that if you're not interested in psychiatry, do not take up psychiatry. See, even if you're not interested in medicine, you can still do medicine. See, medicine is an evergreen branch. Anybody can do medicine and enjoy it. Probably same goes for something like pediatrics. There is nothing to dislike about pediatrics, but there is something to dislike about psychiatry. If you're not a psychiatry person, you might struggle with psychiatry. So in fact, I'll share my experience. In my second year of residency, I was not liking psychiatry at all, because I was not so much interested in the psychosocial issues and all those things. I wanted it to be a completely medical branch. So there was a phase when I was actually hating psychiatry. But then you come into the practice and you realize that you can practice psychiatry the way you want. If you want it to be a pharmacotherapy-based branch, you would do good. If you want to get into psychotherapy and all, as Ankur said, that it is usually taken up by the psychologist. But there are psychiatrists who like doing sessions and therapy and all. If you want that, that is good. But if you don't want that, you can practice like any other medical branch. Some students say that I'm very sensitive and I get sad easily. Would I make a good psychiatrist? I think it would not really make much of a difference. If you are empathetic, if you have patience, that would definitely give you some edge. But that is not the defining thing. And if you're somebody who's not so empathetic, not so patient, a bit more aggressive, or a bit more hyperthymic, if I may use the psychiatric terminology, does it stop you from becoming a good psychiatrist? Again, the answer is no. Like any other branch, you learn the skills during residency. So is the case with psychiatry. Ankur sir, please correct me if I make some mistake anywhere.
No, sir, I totally agree with you, sir.
All right. Okay, so one con as far as psychiatry is concerned is it's very difficult to have an arranged marriage if you're a psychiatrist. So if you are getting into psychiatry, please have a love marriage or find something, because arranged marriage is a big issue.
Sir, Dr. Praveen, just one question I had for you. Sorry, I'm not able to turn on
Atul
my
sir,
camera.
yes sir.
Sir, one of my cousin did MD psychiatry,
right?
And the thing what he said is that it is almost not possible to have a job in psychiatry. So suppose a person is coming from not so financially off background and he wants to start earning and he has a dependencies. For him, is psychiatry a right branch?
Yes, sir. So I'm glad you asked that, and it's very correct that that jobs in psychiatry are almost non-existent. So when I say jobs, I mean there are not many hospitals who would give you a job of a consultant in psychiatry and pay you even 1 lakh rupees. Most of the places, what they would ask you is that you come to the hospital, see your patients, and in private practice there's something called as you split the amount. 70% goes to the clinician, 30% goes to the hospital. This is the model in most of the hospitals as far as psychiatry is concerned. So getting a job definitely is tough. There is no doubt about it. At the same time, sir, I believe that psychiatrists should not go into the jobs. I mean, there is no investment involved. You just rent a place, put 2 chairs, 1 chair for yourself, put a table in between, and you're good to go. In fact, there are a lot of students watching this video. I would advise that no matter what branch you take up, try to get into your private practice as early as possible. This is what I feel. Because when you're young, you're in your late 20s or early 30s, when you have energy, when you are, raring to go, use that energy to build your own practice. If you are in a surgical branch, definitely take an attachment from a hospital because you would be needing it. But starting your own practice when you're young, when you're energetic, use your energy to build your own practice. Why are you making these rich corporate hospitals richer? This is what I feel. It doesn't work for everybody, but this is what I strongly believe. And
Agreed.
And as far as psychiatry is concerned, it's even easier. Start practicing as soon as you can. I did 1 year of SRship and then got into private practice. It never hurt me. So this is one thing. If you're looking for jobs per se, jobs are usually concentrated in the Punjab region and they pay you very well. They are paying 3 lakh, 3.5 lakh rupees per month to freshers also, primarily because of the opioid dependence thing that is there in Punjab. So if you want to get into a job immediately, then you have to go to Punjab. But if you stay back in your place and give some years to your practice, you will flourish. ठीक है. और बताइए अंकुर सर, अच्छाइयाँ और खराबियां बताइए अपनी ब्रांच की. देखिए मैं एक बात बोलूंगा कि all of us are very passionate about our branches and whatever we say, please take it with a pinch of salt because there is a bias. We tend to love our branches a lot and we might be overtly optimistic about our branches. The reality may not be as rosy. So थोड़ा सा pinch of salt के साथ लीजिएगा. हम सब जैसे आपने देखा, when we speak we are very passionate about our branches. So हम सबको तो अपनी ब्रांचेस से बहुत मोहब्बत है. बट तो हमको ज्यादा ही अच्छा बोल जाते हैं कई बार.
Absolutely right.
All right, this question about the super specialties in psychiatry. All right, now I think there is only one branch where super specialty makes sense in psychiatry, that is child psychiatry. Otherwise, see, I'm telling this from the practice perspective. Say you go into de-addiction. I mean, there are people who have done de-addiction DM. Now they are practicing general psychiatry only. As of now in India, at least psychiatry has not penetrated that well that you would be practicing in a super specialty setup. So MD psychiatry as of today is good enough. Fellowship in child psychiatry is good because there's a lot of demand for child psychiatry. Apart from that, there is no good reason why you should go for a DM unless you want to get into academics and you want to go into one of these big institutes. Practice wise, it does not really make much sense to me. ठीक है जी सर. और कुछ विवेक सर, कुछ और बोलना है? कुछ और सवाल रह गया?
नहीं सर, आई थिंक यू हैव कवर्ड ईच एंड एवरीथिंग इन डिटेल. थैंक यू सो मच सर. थैंक यू सो मच.
आई एम सॉरी, थोड़ा साइकियाट्रिस्ट हूं, ज्यादा बोलता हूँ. तो बट सर मेरी एक बात है कि हमारे जो MBBS स्टूडेंट्स हैं, दे आर ओवर्टली पेसिमिस्टिक अबाउट द प्रैक्टिस सिनेरियोस. All of them think that doctors don't make any money and it's very difficult. And I think there's a very negative bias in the social media. When doctors are frustrated, when they are angry, they go out and put posts कि medicine में ये खराब है वो खराब है. And when everything is going good, nobody writes about it. So there's a lot of negative bias on the social media that practicing in India is very bad. It is not bad at all. I mean, all the branches that I see, they are doing wonderfully well. Definitely number of seats are increasing. Probably in future, saturation issue may start to show up. And it is showing up in the jobs at least. I mean, we see that for JRs, hundreds of students are showing up for 20, 30 seats. It was not there when we were doing internship. We would have 10 seats of JR and 12 applicants. So some saturation is showing up in the jobs, but as such in the practice, everything is still very good. I mean, I say if you put me back in class 11th, I would not change a thing about what I did. So don't get unnecessarily pessimistic about what you read on social media. Practicing medicine in India remains a very good thing. And that's it from me.
So can I just take one question? A lot of students are messaging DNB versus MS Gynae,
Please, ma'am, please,
which
please.
is what should you decide? So what I feel is I am a DNB examiner, and I've seen the students who come. So it all depends on where you've done your DNB from. So if you're choosing DNB, make sure you choose a place which has a more patient input, I feel, and second one which has an established teaching program. There are many hospitals which are upcoming and DNB has just started. So do a bit of research, see which hospital you're choosing for DNB. Otherwise, in terms of equivalence for future opportunities, both are very, very similar. Okay, MD, MS, we've had this this debate is never ending. Some people do prefer MD, MS over DNB, but I have seen DNB in very good institutes in OBS and Gynae, in fact, have more exposure, especially towards recent advancements. They are exposed to IVF, they're exposed to fetal medicine, to a lot of laparoscopy, which is not happening in government medical colleges. So there are both advantages and disadvantages. So choose your hospital for DNB very carefully is what I want to say. The pass percentage is actually all right. Whenever we go as an examiner, we try our best to pass everybody. And if you're failing, it's genuinely you don't know anything. That is what. So don't worry about the pass percentage. If you studied, you'll pass. But choose your college carefully or institute carefully.
All right. Right.
May I also pitch in regarding this DNB versus MS and DNB versus MD? See, a lot of debate is happening regarding this. Many students are asking about DNB Ophtha and MS Ophtha also. See, it all depends from where you have done, as ma'am Dr. Raina was saying, and as Dr. Dilip also said earlier, the DNP pass percentages are improving drastically. So there are many good colleges who are giving now the difference, the gap between the DNB and the MDMS is reducing a lot. And further, it depends upon how you take it further, how well you have studied during your DNB, what you have done during the DNB, and even post DNB, what you do after in a super specialization. That also matters a lot. So not only just don't cap yourself, love the subject. The subject is what matters. Okay, if you love your subject, you will do good in DNB also.
Right, sir. So let me invite Dr. Anand to say something. He has been sitting very patiently listening to everything for the last 2 hours. Anand, sir, please.
Thank you, sir. Good evening, sir. I hope my voice is audible.
Yes, sir.
Great. Good evening and regards to all. My name is Dr. Anand and I'll be speaking to the point pediatrics as a branch and as a career. So the first thing is P for pediatrics, P for passion. Passion has to be there. Very important. This branch needs a lot of passion, lot of happiness, and also at the same time, lot of patience also. My HOD used to say that you don't treat the child, you treat the mother, you treat the family. You're not treating the child. मदर को कोई वो नहीं है. यू हैव टू ट्रीट द मदर, यू हैव टू लिसन टू हर. मैंने ऐसे किया, मैंने वैसे किया, मैंने खाना खिलाया, मैंने खिचड़ी को ग्राइंड किया, उसने एक ही चम्मच खाया तो उसने 3 बार वॉमिट किया. शी हैज अ होल स्टोरी टू टेल यू एंड लाइक अ साइकियाट्रिस्ट यू लिसन टू हर. अच्छा आपने ऐसे किया, ओ माय गॉड आई नो दैट बीइंग अ मदर इज सो टफ, बस इतना कर दो, mother is flat and the whole family is flat. The pediatrician is very nice. So number one, passion has to be there. Number two, patience has to be there. And number three, pediatrics, is it an end branch? Yes, mostly yes, it is an end branch. If you're done MD pediatrics, then doing a DM in pediatrics is not very mandatory. Next question, very importantly, whatever branch you take, most importantly, accept that branch wholeheartedly. Don't look back. I have my juniors, sir, I'm in second year patho, I watch your WhatsApp status, I've always wanted pediatrics, till today I regret why I took patho, I wanted pediatrics. So if your life is like this, it's going to be very difficult. So I always say that ask yourself, what do you like? There was a girl, she was messaging, I like surgery but my mother is saying you take pediatrics. No, don't do that. If you like surgery, take surgery. No, girl surgeons are very less. No, it's not like that. You be good at your job and you will be best. It is as simple as that. A lot of extra thoughts brings problem in our life. Next, very importantly, you need to have a balance of private and personal life also. I have my junior, she has done MD pediatrics, she has done 1 year of ICU fellowship, then she got married and she's watching normal cough and cold वाला patient. सर शादी हो गई और cough and 9 to 4 वाला job भी मैं कर सकती हूँ, night duty तो possible ही नहीं है. Then why did you took ICU fellowship? So that's the whole thought process, personal life versus private life, that balance also very important. But if you're good at your job, you will shine like anything. And last question, very importantly, पैसा कितना मिलता है, पैसा कितना मिलता है? सबको सेम ही पैसा मिलता है, ऐसे कोई अलग से कुछ कहानी नहीं है. After MD, everyone start their SR-ship and SR radio, SR medicine, SR peds in our hospital, they get 1.2 lakhs per month. MBBS के बाद JR-ship होती है. In Delhi, you get 1 lakh per month. And after MD, you do your SR-ship, your salary is 1.2 lakhs per month. The only story changes once you finish your SR-ship, then you have those multiple ways of earning money. For example, having evening OPDs somewhere else. Example, working in Sunday को periphery में जाके काम करना. So that is how you start your money growth start to increase. Last point, then my talk is over regarding MD versus DNB. So I work in a college where I'm working as assistant professor, and we have a DNB college. Our college is a DNB college. We have 7 to 8 DNB candidates every year. So I work with them every day and night. The biggest problem they have is the checking of the question paper of the DNB students. It is dispersed and it goes to various cities. Like short questions are checked somewhere else part of the India, whereas short notes or 5 marks question or 3 marks questions are checked somewhere else in different part of the India. So that is why when we listen to that passing rate बहुत late है, या people they take a lot of time to pass. So that's true, because the the whole program is quite difficult to get it. So that's the only thing. But rest, by the end of the whole story, if you are good at your job, you will shine. There is nothing known as saturation. That's it, sir. All questions I've answered. If anything you feel like, Dr. Praveen Tripathi, sir.
Sir, Dr. Anand sir, please a little bit tell about DCH also.
सर DCH DNB ये सब सेम कैटेगरी के हैं. These are all almost the same thing. MD versus DNB, of course MD will be there. Recently one of my SR who gave an interview, there were 8 DCH students, one was DNB and one was MD. The MD was given the first preference, frankly speaking, क्योंकि टैग बहुत इंपॉर्टेंट है. कॉर्पोरेट्स को टैग बहुत चाहिए होता है. MD, like the corporate also wants to go to a higher level. So if MD is not there, of course DNB is a wonderful option, and there are people who have done DNB followed by DCH also. So whatever rank you are getting, if you have interest in pediatrics, take it, you will shine. बस इतना सही है, कम ज्यादा कुछ नहीं है.
Thank you, sir. Thank you very much.
Dr. Gobind sir,
आपका भी
Gobind sir.
कौन सा आपने कभी नोटिस किया हो? Anything that you have you told everything very positive. Any cons that you notice in pediatrics?
Cons, it's difficult to diagnose cases basically. Bacha will not tell you कि my little finger is paining or there's a pain in my lower back or I have a sacrococcygeal teratoma. He will cry, and
Yes.
that's it, cry. And
Exactly.
ये
That
बहुत
is why I
बड़ी
wanted to
problem.
bring up. That was thing that I noticed during my internship, that mother will bring the child and just lay it down on your examination table
Yeah.
and say that the child is crying. Now you search the entire body where
Yeah.
what is gone. I
So
could
that
not.
is why patience is very important. P for pediatric, P for patience. I have one of my junior. She paid 4 lakhs rupees bond after working 1 month in pediatrics. Coming out of pediatrics, sir, I watch your WhatsApp status. I thought I will have a very happy life. Lekin I gave 5 lakh rupees. I came out. मेरे को नहीं करनी pediatrics like that. People come. So इसलिए I always tell to everyone that don't look at my face and say pediatrics is very beautiful. Ask yourself, do you like pediatrics? If you like, then please proceed. It is as simple as that.
Thank you.
Thank you, sir. Thank you, everyone. Yeah. Yes, sir.
Thank you, sir. Dr. Gobind sir, a lot of students are asking for all the branches, degree versus diploma versus DNB. So I'll just like to add few things to what Dr. Anand has already mentioned. Friends, if you love a branch, these things become secondary. But practically speaking, if you are going for private practice, then DNB degree diploma won't matter much. You will get enough experience in all these branches are quite heavy in India. But if you're going to apply for a job as a faculty in a government medical college or as a consultant in a private corporate sector, even if they advertise that they will consider everything equivalent, it is an unsaid rule. They will always prefer, mostly I've seen they will prefer MD over diploma or DNB when they're actually choosing for their own institution. So this is what is my experience. Anyone else has a different experience, please do share.
Sir, I totally agree with you. This has happened to me only actually. I gave my SRship in a SRship interview I had given. Mehra selection ho gaya, everything was perfectly fine. Later, by the back end, after 3 months, I got to know that there were 7 DNB students. There was only 1 DSCH and 1 MD, and I was the only MD. So, मतलब वो उसमें ना marks भी होते हैं. They only told me there's a marks. How much percentage you got? Are you MD? Are you DNB? Are you DCH? There are marks even for that, and that's how the whole story goes. So it's a hard truth, but this is the fact actually.
System is like that. System is like that. We can't.
Govind sir.
Yes, sir.
Sir, I think now we should invite Dr. MSD sir for dermatology, and then we will move to Dr. Gaurav sir for ophtha. So Dr. MSD sir, dermatology.
Thank you so much, sir. Am I audible, sir?
Yes, sir.
Okay. So first of all, hearty congratulations to all the students who are watching this after getting a great rank, and you are in a dilemma to select the branches. So I will give my perspective regarding dermatology. So first, Abhi, after getting the rank, so you want to join a branch. So dermatology about this is a end branch. So there is no need to again prepare for any super specialty. This is the first good thing about dermatology. And coming to the most important point, that is a work-life balance. So as in the cerebellum, get the balance right, we say. So in the life also, you are going to have a great balance with the dermatology, because here basically during your residency there might be some emergencies, like for example we have discussed drug reactions, the vesiculobullous disorders, SGST and pemphigus, bullous pemphigoid. So they might be the emergencies which you might attend during your residency, but after which in the life, that is also important, like you're not going to be single, you're going to get a family life. So you should always think about the future and then opt for a branch. So if you're not a person who likes the adrenaline rush to treat the patients 24/7, always attend the emergencies, if you want peace of mind also, and also you want to enjoy the family time, you are going to get the kids, you are going to get the responsibilities which you need to take up to drop your child for the school, to attend parent teachers meeting. So if you नजदीकी फायदा देखने से पहले दूर की नुकसान का भी सोचना चाहिए. So this is what all of you should remember. So in that perspective, dermatology is very good, which is going to give you work-life balance. You are going to have only the timings which are 9 to 5. Like you can keep the timings whichever you are in okay with, and after that you can switch off your phone. There are not going to be much of emergencies, unlike the other branches. Even in surgical branches, you are going to be responsible for your patients. You cannot stop the delivery from happening. In the night at 2 o'clock also there might be a delivery, so you might get a call. So this thing is not going to be seen in the dermatology. That is first thing. And regarding medicine and surgery, so previously medicine used to be like dermatology used to be a part of the medicine, and it used to have the core dermatology, only diagnosis and the treatment part, management with the medications and the creams. But now it has evolved a lot. So now in the dermatology also we are having surgical aspect. Like for example, there are surgical procedures like vitiligo surgery is there, and there are hair transplant, which is a separate branch where after completion of the dermatology, you can completely go into the area of hair transplantation only, and you can also earn a good amount of money if money is your concern. Okay. And yeah, coming to this, this is basically a visual field. So the pros about the dermatology related to visual field is you can just see the lesion and you can come to a diagnosis. Okay, that is a pro. But what is the cons related to this thing is some conditions, okay, most of the conditions in dermatology are really very chronic. They are going to require a lot of patience, both for the doctor as well as for the patient, because they are going to come again and again for the consultations saying that, Dr. Saab, whatever treatment you gave, there is some improvement, but it is not completely gone. Okay, this is one thing which the patients might complain, and also doctors might feel a little bit dicey. And also in dermatology, remember, there are some conditions which are very commonly encountered, but there is so much to read. Okay, if you are thinking that they are only the acne है, बस ये कुछ conditions और rashes होते हैं, इसका कुछ treatment सबका steroids होता है, नहीं ऐसा नहीं. There are so many medications which are there right now. There are so many monoclonal antibodies which you might have also read in your pharmacology, which are being used in the field of dermatology. So there is so much of future perspective both in the core dermatology and also in the surgical field, surgical side of the dermatology, which is happening. Okay. And so one more thing which many students have asked. So there are BDS and MBBS people who are doing some courses, bridge courses of 3 months or 6 months or even 1 week, and they are also practicing dermatology. So what about this? Yes, this is one of the con we can say, because you can see in Instagram also there are so many skinfluencers, and in YouTube also कोई भी एक आता है और क्रीम एक दिखाता है और बताता है इसको लगा लो तो लाइफ जिंगलाला ऐसा मतलब ऐसा कुछ आ गए हैं लोग. Yes, that is true, but IADVL is our association, Indian Academy of Dermatology, Venereology and Leptology, which is trying to stop all these types of quacks, okay, skin influencers, quacks. But patients are not they are very intelligent. They are also looking at the degrees of the persons who are doing the treatment. But yes, still this is one of the problems, even in the metro cities also. Yes, there are some BDS people who are practicing. What they will do is they will take a dermatologist on the board, and they will say that we have a dermatologist, and at the back end they are going to do the processes. This is one problem which is really there. And about the investment, so many students have asked me, sir, dermatology mein lasers hote? Yes, lasers. And of course, the hair transplantation. These are all there. But let me tell you, if you do not have much money to invest for the practice, so you can just rent, you can take a polyclinic, rent cabin for 10,000 rupees or 20,000 rupees a month, and you can just see your patients. So what we need in dermatology is, if you have read the topic, by looking at the lesion, you can diagnose the condition. Okay, nothing much is needed. Not even a biopsy is required in so many cases. You can diagnose the case by looking at it. Yeah, slowly, if you build up your clientele, then you can ultimately, take any lasers if you wish to, and you can do the laser hair removal or pigmentation. These treatments can be given. And at the beginning also, while you are not having so much of money, you can also rent, okay, the machines. That is also one of the options. Lasers, they are also available for rental. So if you are unable to have so much of money for the investment purpose initially, you can do this. Okay. So these are the main doubts. And yeah, for coming to MD, DNB diploma, so it was already discussed. So I will put my point, since I have done diploma as well as secondary DNB. So students, if you are really passionate about the branch, and if you are getting MD or MS and a diploma in your favorite subject, and MDMS in not so favorite subject, so I would like to put my point that you can, if you want to take the passionate subject, you can take the diploma. But remember, do not stop with the diploma, because the possibilities which you can go into are going to be less in the case of diploma. Like Vivek Jain said, if you are going for private practice, this is not going to be a concern. But if you want to go to a medical college, definitely this is going to be issue, because you are not going to be promoted more than a senior resident. You have to have a DNB, secondary DNB, which is going to be 2 more years after the completion of the diploma. So after diploma, there is an examination called as PDCET, post diploma CET, which is going to be a 2 years course. And for this exam, the entrance questions are going to be only related to the subject which you are writing. For example, if you want DNB, PDCT, dermatology, you have to read everything about dermatology. When I wrote the PDCT, the examination had all the subjects, okay, all the 19 subjects. But now the rules have changed. The PDCT examination is going to be only related to dermatology questions. Okay, so once you get a good rank, so there also one more difficulty is there in DNB, PDCT also, the seats are very less. So that is totally your call about the diploma in your passionate subject and the MD/MS in not so interested subject. So the final call will be yours. And these were the points which students have asked, sir. So I rest my case. So
Dr. MSD, sir, just one last question from Dr. Anubhuti. We know radiology is a investment heavy branch to pursue if you want to invest your own earnings or something. Is derma investment heavy branch?
So actually, I told a few points about the investment part, Dr. Anubhuti. So if you are not going to have so much of money for the investment purpose, you can just start your OPD, increase your clientele, and you can also have these equipment, the lasers, and also the OT chamber for a hair transplantation. All these things you can also take for rent. Okay, that is one option which is available right now. Previously, it was not present, but now it is very much available. You can just pay 50% to the person who is giving the rent for whatever procedure, and 50% you can keep with you. So you can do this initially, but as you are going to be with dermatology for a few years, you are going to earn so much of a good amount that slowly you can also add on the equipment for your private practice for yourself.
Thank you so much, MSD sir. Now we move on to Dr. Gaurav Nagpal sir, ophthalmology. Sir, first question a student is asking, then you can take over. Please answer this question first.
Yes, sir.
I don't like emergencies. Is ophtha meant for me or not?
Sir, ophtha does not have much emergencies. Only 2-3 emergencies are there, which are there like retinal artery occlusion. This I tell in my classes also. There are very few emergencies, actual emergencies, which are there, like a chemical injury patient has come or something like that. Very few of emergencies are there, which are mainly being catered by mostly government setups or by charitable setups. So that is where most of the emergencies will land up. But yes, absolutely right. The work-life balance is very, very good from an ophthal point of view. I know many faculties before me have also been telling about their branches. But in ophthal, it is a very, very balanced life. It all depends upon how much time you want to put into your practice or your work. You can easily balance that out. It's a perfect, for ophthalmology, I would say it's a perfect mixture of surgeries, medical ophtha also. You want to practice as a surgical ophthalmologist. There is a lot of scope there. You want to practice just like a medical ophthalmologist, lot of scope is there. And in both of them, sky is the limit. Even if you just wish to practice like a spectacle shop owner, many of our faculties are using spectacles. So they get their spectacle made somewhere. So just imagine if those spectacles are being made by a doctor, are being dispensed by a doctor. Okay, obviously the patient will go to that specialty. So that is where, and spectacle is something that every person will use during their lifetime. Even if they're not using when they're young, when they grow old, they would require some sort of spectacles at that point. So they would require an ophthalmologist. This is one branch where every person is going to go. Okay, I may not have had any skin problems till now. So I've not visited maybe dermatologist. And if somebody is lucky enough who's not had any surgery, maybe they've not had the opportunity to go under Dr. Amrit, or maybe Dr. Jhanvi has not been able to meet them. But ophthalmologist is something that everybody will have to meet sometime during their lifetime. So we are never out of practice. A lot of scope is there. Regarding some students are asking surgical cutting and all. See, whatever surgeries, it's a very evolving branch. Whatever surgeries that I am doing now, I did not learn in my MS. Okay, so it is something which you keep learning over the years. And believe me, your colleagues, your friends, this I tell those who have been asking me, you keep learning. So newer surgeries are coming. So this is where. One con that is there because of this is because it is always evolving. It is a very cost intensive branch. So if you're planning to set up your own practice, be ready to shell out a lot of money. Whatever you are earning will go, lot of it will go into your practice only. Your practice is going to eat up a lot of your earning because you have to upgrade your instruments. You have to keep upgrading your technology. It's very fast changing technology. The lenses that are coming are now, which are absolutely top of the block. So but they at the same time, it is very, very costly. So that is where that is a big con. So if you have a good financial backup and if you want to set up your own practice, well, absolutely good. If there is already a practice in your family, nothing like it. Regarding jobs, jobs in government sector are very, very less. You open up any advertisement that you get, you will not find MS Ophthalmology. I just keep searching for MS Ophthalmology jobs. I don't see ever. They just vanish before coming into the ads only. Then I don't know how they get filled up even before coming into the ads. You will never find. Regarding jobs in corporate sector, uh, the graph has a very ceiling there. You after initially there would be a good rise, but then there is a ceiling effect. So that is where in a corporate sector you feel ki, okay, it is better to set up my own practice. And that is what you must have noticed. Even in your cities, if you notice, the bigger hospitals, they do not have their own opthal setup. They always rent it out. Why? Because it is a very investment heavy branch. So the corporates also tend to invest in other branches rather than investing in ophthalmology. So because there is a less of ticket size, but it's a very gratifying branch. There is instant gratification when the patient gets a good vision. When there is absolutely the joy that you see on the patient's face is absolutely gratifying. Okay, so that is regarding the ophthalmology. And regarding DNB, I've already said about the DNB MS difference. The gap is lessening very much. The gap is not too much now. Even DNB Ophtha from a good institute is a very, very good option until unless you're looking for a job, which anyways is very less. So if you are getting DNB Ophtha from a branch, then definitely take it up. One point regarding super specialization. Now it is very, very mandatory. Now, whatever people who are pursuing their primary DNB or maybe who's doing MS, they do have to do a fellowship. So nowadays, be prepared to do a fellowship in either cornea or phaco-refractive or glaucoma or oculoplasty. There are different fellowships which are there. So that has added to the burdens that after doing your 3 years of MS, you will have to do a fellowship in some branch. Okay, so that is there. Yes, Dr. Shreyas, you can practice Ophtha solely as a medical practitioner also. There is lot of, I was just telling, if you want to practice as a glaucoma specialist, if you want to practice as a spectacle specialist, you can do as purely medical specialty also. Saturation in Ophtha is not there as of now. Lot of, in maybe metro cities, yes, it is getting saturated. But in tier 2 cities, tier 3 cities, and in smaller cities, saturation is definitely not there, Dr. Himanshi.
Sir, otherwise also I believe the concept of saturation is more applicable from the perspective of, let us say, getting into a job. Somebody who wishes to start up with their own, setup is not going to be encountering this. But I read a lot of comments, sir, since you, specifically put a lot of emphasis on the fact that it is a investment intensive branch. So people are asking about the average, expenditure that will be incurred by them if they happen to, finish up their MS. So any tentative idea, sir? I mean,
For a basic ophthal OPD setup, I would say you would require something like 25 to 30 lakh of rupees apart from the place. So a basic setup from OPD setup only, which involves a slit lamp, chair unit, an indirect ophthalmoscopes. From that, you just require something, a basic setup. If you want to set up a OT also, which just as I have, it goes up to 1 to 2 CR. And if you want to set up a LASIK setup also, with the vitreoretina setup, then it goes up to something like 5 to 7 CRs. So that is that is why I'm saying, and this also has a shelf life of only 5 to 10 years. And during that 10 years, you have to recover that cost because then machinery tends to get outdated and upgraded. So that is why I'm saying it is a very cost intensive branch. But otherwise, it's a very balanced branch in terms of medical and surgical portions both.
Thank you so much for that input, sir.
Sir,
Did I miss any question? If you have any question, if I've read in the chat and any question that I should answer.
Sir, most of the students had asked about the investment only, and I think you have discouraged them, is it?
No, I'm not discouraging them. I'm just telling them that I'm just opening up their eyes that you have to be prepared for it. Okay. See, I'm running my own practice, so I'm happy with it because in my earlier I also tried to get a job, but getting a job in ophthalmology is not very lucrative. There is a very in 4 years there was a ceiling effect. So I realized that as a surgeon, as Dr. Apurv has said, the surgeon has to have a graph, which is, and Dr. Raina also said, surgeon has to have a graph which has to go through the sky. But in a corporate setup, in a job, there is a ceiling effect. So that is why I ended up into a private practice, and private practice is something which is giving me good returns now. So now my returns are obviously much more than investment. So I'm just telling you, in the initial part, you have to be prepared for it.
Wow.
That is a very wonderful perspective, sir, because if the students can foresee that they have to kind of have that kind of an investment, maybe they can have a better financial planning.
Yes. Somebody who's not from a very good financial background should think about this, because I did not know about it when I entered ophthalmology. Because I was not from a very good financial background. I did not have so much of investment. I had to collect and invest a lot, and I had to put in a lot of effort, and had to work extra so as to be able to get those returns out. So that is what I'm trying to put in. You should be prepared for it, because this was something which was never told to me when I entered ophthalmology.
Wow.
Is ophtha good for government? But a government, you will not get any jobs only. That's what I was saying. Even before the ads come into, because there are so much of people who are already working as ad hoc lecturers, who are maybe working as observers in government setups, that they get absorbed, you don't get a government job. So government jobs are very, very scarce, Dr. Mehra. Average salary depends upon whether you are working in a corporate sector or in a corporate sector. It's something like 1.5 lakhs in Delhi. I'm telling, it's the starting salary which is there, and in tier 2 cities maybe it may be less. Diploma of Thal is very, very good. It is not, but you'll have to follow it up with a fellowship. I was telling you for MS also. So even after diploma, you'll have to do a fellowship. Once you do a fellowship, it takes care of your DNB, diploma, MS, everything.
So, sir, on a lighter note, what salary will you pay to an ophthalmologist joining your clinic?
See, as of now, I'm not satisfied with whatever the work I'm
Just
doing.
on a lighter note, sir.
My satiety center is set very high. So even I'm not, my satiety center is very high.
Atul sir, with your best wishes, we will be talking about this maybe sometime in 2026, 27, sir, when Cerebellum is going to come up with its own chain.
Thank you so much, Gaurav sir. Thank you so much, Gaurav sir, for such a detailed insight into the branch. Many things even I came to know about today only, right? So if everyone permits, yes, please, sir.
Sir, one student asked about things to ask before opting derma in colleges. Can I answer, sir?
Yes, please.
So students, if you want to opt the dermatology during your research, you should try to call the residents directly if possible and ask regarding what is the nature of the department head and how is the department, whether like always there will be some toxic nature in the department. Why? Because dermatology is a cool subject and we don't want to go into the toxicity unnecessarily. So try to ask how is the department in that concerned college, and also try to ask whether there are academics, which is very important. So from 9 to 1 you are going to see the OPD. Afterwards, what are you going to do? The academics, which are very important, journal club, case presentation. So if they are happening, that's a great thing. If they're not happening, then the amount of knowledge which you are going to get is going to be reduced. So that thing has to be taken care of. And also, yes, equipment, whether they are lasers, whether a fractional CO2 laser and laser hair removal, whether these are there, or radio frequency cautery, electrocautery, whether these are present and working condition or not. These are the things which you should definitely ask before joining a college, which for dermatology. Yes, sir, this was.
Thank you, sir. So Govind sir, if you permit, can I start with PSM? I'll just take 3 to 4 minutes maximum.
Sure, sir, sure.
Okay, sir and friends, for PSM, I'll start with the pros.
I think Dr. Praneeth is also there.
Okay. Okay, yes, sir. Dr. Praneeth is there. Yes, sorry, I missed. Dr. Praneeth, sir?
Yes, sir. Just
Okay.
a minute, sir. Just a minute.
Yes, please. I missed you because you didn't switch on your video.
No, sir. Hi, sir.
Hello, Dr. Praneeth, sir. So kindly
Hello,
take
sir.
up for ENT first.
Yes, sir. See, ENT, many of the students are having that there is no future. I'm getting even messages Students are asking, sir, ENT में कितना मिलेगा बाद में, मतलब how much we can earn. So these are the common questions that have been answered till now. So MS, DNB, what is the variations and pros and cons? Most of the questions are already answered by most of our faculty, sir. And coming to the ENT side, exclusive ENT side. See, actually, one of the students who messaged me recently is that, sir, I didn't attend any of my undergraduate postings in ENT, but mostly I may get only ENT. Will taking ENT, is it better? So for that, my answer was yes. Even I too didn't attend much of the postings in undergraduation in ENT. So it does not depend whether in undergraduation you have attended most of the ENT or opthal. So most of the students will be interested in going to medicine, surgery, obstetrics. Definitely yes. Even I was the one among them. So it doesn't matter. Once you go into the ENT, and I mean any branch, once you enter into the branch, it's up to you to develop interest in that, up to you to put a decent amount of efforts in that, and accordingly you can come out. Your amount of efforts are directly proportional to the amount of result you are going to get later. It's not that only this is the branch you need to take, this is the branch you need not take. I don't think so there is anything like that in that. If you have any, one thing I can say, sir, those who are taking ENT, they should have some interest in surgical branch, in doing surgeries, some passion in doing surgeries. If you are not interested in doing surgeries, I don't think so ENT will be a better option for them. What you see from outside is just like a tip of the iceberg. So ENT appears like a tip of an iceberg, but the actual thing lies inside that, and you can see only that when you enter into that department and you go into deep, you will get that. And from my side, this is any specific questions, sir, from students? I'm not
Sir,
able to see the chart.
Sir, one question is same. If I want to start my ENT setup, private clinic, do I need a big investment?
Yes, sir. If you want to go like a full-fledged setup with all the latest equipment which are now upcoming in the ENT, like microdebrider and a cobblator, and you want to go with a high-end STARS 3-chip endoscopy set, so it is going to cost you 1 to 2 CR definitely. But coming to me, sir, when I'm not a person who has come from a very big background, sir. I don't have any financial background. But when I came into the practice, all and all I had is a portable endoscopy system. The cost of that was 45,000. It's a portable endoscopy system, and some instruments, everything somewhere else costed around 40 to 50 again. So with a 1 lakh setup, I used it to do freelancing initially in that first 2 to 3 years. In the entire area, 15 to 20 hospitals nearly, I used it to do freelancing. So once I started doing freelancing, so slowly it built up. Slowly the career got built up, and now I have my own setup. And my setup, sir, I have a very small setup. We started it as a only clinic, and now I have a OT with 2 rooms. I mean, it's a very small setup because I usually have daycare surgeries. So ENT, there are no emergencies mostly, unless epistaxis like are only emergencies you have. But most of the time you don't have much emergencies in ENT. So those who don't want to go into any emergency like branches, so they can opt for ENT. And all in all, this kind of setup costed me 40 to 50 lakhs.
Sir, one more question is there. Work-life balance in ENT.
Yes, sir. Work, you see, it depends on you how much you can afford up to. See, there is scope. If you want to do more hard work, you have a lot of options. See, I have my own setup. Apart from that, I do get calls from multiple hospitals to attend for OPDs or surgeries. It's up to you to decide. If you afford to go for even outside other hospitals and do work there also, you can go. As a freelancer, you can go. And then if you want to get limited to your own setup, even that is also fine. Initially, in the initial days of practice, I didn't get enough time because I was doing freelancing all the day round. Hardly I did get any sleep, sir, in the first 2 to 3 years, I remember. That was the amount of hard work that was kept initially, but things do turn up slowly, obviously. That's what I say, amount of hard work is always proportional to the amount of results you get. That applies for any profession, of course. And it can easily be balanced. It's up till where you get satisfied up to. If you want to earn more, you have to work hard. So you have to do a little bit of more work. But ENT side from my side, I can say it's a for my own setup. I do, sir, morning 1 or 2 surgeries will be there. So it's a daycare surgeries. Morning you do surgeries, evening you will discharge them. And OP in between, you will have OP in the morning and evening, 2 to 3 hours, 2 to 3 hours OPs will be there. And afternoon, you'll get 1 to 2 hours break. And that's it, sir. So yeah, the day goes by. So not a very hectic work also. At the same time, not that much easy also. Very simple also. So
Okay.
it's a decent. So you can easily balance. It depends on the person himself.
Okay. And Dr. Praneeth, students are asking if what is the average salary one can expect in corporate sector?
Sir, there are actually various setups, sir. Initially, sir, in 2018, when I came for this practice side, I used to earn 60,000 a month, sir.
Okay.
Now I know, as far as I know, now they are paying 80 to 90, it seems, per
Okay.
month in a
Okay.
corporate ENT setups, exclusive ENT setups.
And you are
Yes, sir.
mentioning
But
in reference to your city, that is
yes,
Hyderabad,
sir,
right?
Hyderabad, sir.
Okay.
Hyderabad, people are earning somewhere in big ENTs also, so maximum 1.2, 1 point like that they are earning. And they are having their own evening setups also.
Sir, in
In a
Delhi,
government,
definitely it is slightly higher in Delhi.
yes, sir, definitely. But sir, coming to money side, peripheries are having more amount than cities, definitely.
Mm.
In peripheries, you have, if you want amount, you have to go to periphery.
Thank you. Thank you so
That
much.
all those points are already maximum dealt with, sir.
Thank you so much. Thank you so much, Dr. Praneeth, sir, for such a detailed insight. Dr. Govind, sir.
Yes, sir. Now you can start with the PSM and
Okay.
non-clinical.
Thank you, sir. Friends, I will just start by saying one thing. Take PSM only if you love the subject. Every year I get queries from hundreds of students, and mostly students who discuss with me in detail. When they actually get something else in the counseling, they do not take PSM. Rather, an equal number of students who take PSM actually call me after taking PSM. And they inform me, sir, I have taken PSM. So this is something you have to decide, that I don't want you to leave the branch in first, second, or even third year of MD, right? Now we'll start with the pros. You have been in a medical college, you have seen faculty position if you can get. Saturation is just like any other branch. If you can get faculty position in a government or a medical college, it is purely a 9 to 4 job. You will get a lot of time to teach. You will be involved in national health programs also, and you will get a chance to associate and work with international health agencies also. So getting into a medical college is a very balanced 9 to 4 job. All the leaves, everything will be available with you. I started by joining International Health Organization, United Nations Office on Drugs and Crime. So I've seen that side also. That will give you a very good boost in the early part of your career, because I joined the field only for work. And I actually enjoyed International Health Organization work because they actually work like MNCs. 24/7, 365 days a year. Salary from government to jump to International Health Organization will be minimum 2 to 3 to 4x, no doubt at all. But they will make you do work which will have a lot of creative satisfaction. You will feel very satisfied. Actually, you will get a kick out of it. But again, there is a bias because I chose PSM by choice. So that should always be taken into consideration. If you are not able or you don't want to join International Health Organization, you always have an option to join government bodies like National Center for Disease Control in Delhi. Only con with this is most of these agencies are based either in the tier 1 cities like Delhi, Hyderabad, Mumbai, Bangalore, or they are based in the capital city of your state. That should be kept in mind. National health programs always have job vacancies available. We are expanding, the programs are expanding. You will always get a good quality work to be done. NGOs you can join also. Please remember, in government bodies, national health programs, or NGOs, if you work, your salary structure would be at par with the government sector medical college. This you have to. Many students were asking, what about clinical private practice after doing MD PSM? Yes, you can do. I know a lot of students. Two of my closest, Dr. Ruchika, who works and who is managing a clinical practice in Ghaziabad, Delhi, and Dr. Vashist, I know of as a senior in Southern Delhi, used to do that earlier. Surprisingly, unknown reason, there may be a bias, but maybe they learned so many communication skills were developed during the MD course. They are doing amazingly well, even better than the clinicians in their area. So this is something also you can try to check. You will learn patient management if you actually want to do at your health centers, which are attached to your medical college. You will learn immunization services and everything, right? So that should be kept in mind. Now I come to the cons. The biggest con for PSM as a field, you will not get any job in a corporate sector, especially a hospital or a nursing home. If I'm doing a clinical branch, I can walk into tier 2, 3 cities easily and I can apply for a job I will get if I've done anesthesia or something. But there is no specific separate job for a MD PSM. If you go in a corporate hospital like Fortis Max, or even if you go to a nursing home or smaller hospital setup, this should be kept in mind. International Health Organization jobs are mostly travel related. Initially, you'll love it, but they are actually very intense jobs. So if you love traveling so much, then definitely you can do. I can tell you by my experience, most of the persons who stayed in international health organizations for long are actually single. So this is not just by chance. This is what I've seen. They are mostly single. So either divorced, unmarried, or separated. This may be just my personal observation, but this should be kept into account. It is not a 9 to 4 job. This you have to remember, right? Now, how to choose college if you get a chance and if you want to pursue PSM as a career? Last thing I can mention, try to stay to or stick to tier 1 cities. Delhi is best. AIMS, MAMC, LH, UCMS, VMMC. They are definitely best, no doubt at all. Otherwise, Mumbai. Otherwise, central institutes like PGI Chandigarh, JIPMER. Also, please have a look at BHU, AIPH Kolkata. Also have a look at the upcoming AIMS, especially Jodhpur. They are doing amazingly well. That should be kept in mind. Vardha, you should definitely look at. In case you are not able to secure a seat in these top colleges for PSM, try to go to the capital of your state, capital city of your state, because that will open up a lot of opportunities. But at the same time, I should definitely tell you, 5 years down the line, government, private college, name of the college, nothing will matter. What you have learned during your MD, how many skills you have developed, what kind of work you have taken, what kind of thesis you have done, that will actually define and shape your career. Right? Okay. Thank you, Dr. Govind sir. This was all from my side. If students still want to have a detailed discussion on this, please watch our video Pros and Cons of PSM as a Career by Dr. Vivek Jain. It is on Cerebellum Academy YouTube channel only. Then we can connect over a call whenever you are available. Thank you, sir.
Thank you, sir. Thank you so much. So I think I can take up pharma now.
Yes, sir. Definitely, please.
So I will start with the totally opposite statement to Dr. Vivek. If you love pharmacology, do not take it. Pharmacology as a subject, because when we study, some people, they find pharmacology very interesting. They find there are drugs, there are so many mechanisms, etc. But it has nothing to do with your career. So that is very important. So सबसे पहले I will talk who should not take pharmacology. And that is the single most important point, that if you want to have any sort of patient interaction, do not take pharmacology, because it is a totally purely non-clinical branch. You will not have any patient exposure. फार्मा वाले जितना मर्जी कहते रहे डिपार्टमेंट में कि हम जाते हैं, हम हॉस्पिटल जाते हैं, बट पेशेंट को ट्रीट नहीं करते हैं, कोई इंटरेक्शन नहीं होती, मेडिसिन वाले हमें कुछ नहीं समझते, सीधी सी बात है, बिल्कुल प्योर है. सो अगर पेशेंट देखना है तो फार्माकोलॉजी इज नॉट फॉर यू. सो इफ यू आर टोटली ओके कि पेशेंट नहीं है, कोई प्रॉब्लम नहीं है, देन फार्माकोलॉजी इज वेरी गुड ब्रांच. सो after pharmacology, what you will do? So there are two main type of scopes. Obviously, बाकी sideways तो आप कुछ भी कर सकते हो किसी भी branch में, they are common. In pharmacology, two major scopes are: number one in the teaching and number two in the industry. So teaching, like everyone said, government jobs are very rare nowadays. बहुत ज़्यादा नहीं है. But private sector में, private medical colleges में, there are a lot opening up now and there are plenty of jobs. So job की problem नहीं है. After MD you will get a job in the teaching also. And the pay scales are not very great. Pay scales अगर आप गवर्नमेंट में जाओगे तो स्टैंडर्ड सब जगह सेम है, 1.2 के आसपास है. बट प्राइवेट सेक्टर्स में भी वो 1 से ज़्यादा यूजुअली नहीं देते हैं एट द बिगिनिंग टू. एंड अगेन दिस विल नॉट राइज ऑल्सो, बहुत जल्दी राइज भी नहीं होगा. ठीक है, यू कैन फील के इवन आफ्टर 5, 7, 10 ईयर्स भी वो, मतलब आज की डेट का अगर कंपेयर करें तो वो 1 का 1.5 हो जाएगा ज़्यादा से ज़्यादा, मे बी 2 हो जाएगा, उससे ज़्यादा नहीं होगा. You can expect too much rise in the teaching, but the advantage in the teaching is you have plenty of time. Okay? So you can take care of your family and you can enjoy life. Okay? So passions, whatever hobbies you have, you can pursue that. Okay? So there is plenty of time you can utilize. So teaching में तो ये है. Then second is industry. In industry, again, there are good scope. But problem in industry, first of all, we'll talk about problems. The first problem is you need to settle down in bigger cities only. मुंबई में बहुत सारी जॉब्स हैं, हैदराबाद, बैंगलोर. तो बट इफ यू वांट कि आपको जॉब आपके शहर के पास मिल जाए, यू नीड टू वेट. मिल सकती है, या लाइक देर आर जॉब्स इन दिल्ली, गुड़गांव ऑल्सो. बट इफ यू आर एडमेंट के मुझे दिल्ली में ही चाहिए, गुड़गांव में ही चाहिए, मे बी द वेटिंग पीरियड इज 2 years. बट इफ यू आर रेडी टू गो एनी वेयर इन द इंडिया, यू विल गेट जॉब वेरी इजीली. जल्दी मिल जाती है, बहुत इजी. एंड सेकेंड इंपॉर्टेंट थिंग, देर इज लॉट ऑफ ट्रैवलिंग एज डॉक्टर विवेक सेड. यहाँ पे बहुत सारे ट्रैवलिंग होती है. इफ यू डोंट लाइक ट्रैवलिंग, देर विल बी अ प्रॉब्लम. थर्ड इंपॉर्टेंट थिंग, I think Dr. Atul भी है. Dr. Atul can add on to these things.
Yeah. Thanks a lot, Dr. Garg. And you have given a very, I really like the way you brutally give your reviews. Sorry, I'm not able to switch on my camera, and I am into the corporate at a senior position. Whatever you are saying is right. The career, if you ask me, the career is good. The starting salary will start somewhere near 15 lakhs a year. That is around 1.5, 1.25. But it multiplies very rapidly. You can say that every 4 years it will become double. So it's common for people who are around 45 to get somewhere near 1 CR. So, and regarding the other things, there are different the kinds of things are there. Like traveling job will be there if you choose a medical marketing branch. So many times people think that pharma industry is one field. No, pharma industry has 4-5 different fields. So if you choose medical marketing, you will have to travel a lot. If you go into research, pharmacovigilance, you don't have to travel that much. In fact, minimal travel. Regarding the number of jobs, there are few cities where the jobs are more, like Hyderabad, Bangalore, Mumbai. In Delhi, it is less, but nowadays a concept of work from home is coming in. So that is definitely a big plus. And the negative thing is it is not a passive job. You have to be on the toes. And it is not only that your medical knowledge, you have to be a 360-degree personality, your communication, the way you handle the things, your people's management, your communication skills, your crisis handling things. And so all these things matter a lot. And definitely there will be office politics and all those things will be there. So if you want an easy life, no, that's not for you.
Dr. Atul, I want to ask, like you said, there are medico marketing and other fields in pharmacology in industry. So are the pay scales similar in both of these things, or medico marketing is the one which the person gets rise very quickly?
Pay scale is by and large similar, but in medico marketing, the number of jobs are more. So you can say that sometimes it may happen that some person may rise bit early in medico marketing, but the p value amongst different fields is not significant. If I tell you that as an absolute terms, I can say yes, medico marketing has higher salary, but the p value is not significant. So that should not be the reason to choose medico marketing.
Thank you, sir. So guys,
Atul, now we know your salary, Dr. Atul. We got to know your age. So now we know how
No,
much.
I was giving a general idea.
Acha, guys, so regarding pharmacology, I will quickly sum up. You need to choose pharmacology only if you do not want clinical. अगर clinical 1% भी चाहिए तो फार्मा मत लेना, ठीक है. And when you choose pharmacology, you have two options. अगर आराम से जिंदगी जीनी है, टाइम चाहिए बहुत सारा अपने लिए, तो पैसे को त्यागना होगा, and that is the teaching job. और अगर बहुत सारा पैसा चाहिए तो आराम की जिंदगी को त्यागना होगा, बहुत मेहनत करनी पड़ेगी. Both options are there. It's up to you to choose.
Absolutely true. Absolutely true.
Dr. Vivek.
Very well summarized, Dr. Gobind Rai Garg, sir. Okay, now we move to the pathologist, Dr. Sparsh Gupta, sir. Kindly take over. I know Dr. Devyani is waiting since long. Dr. Devyani will have to wait a bit long.
Just about 2 or 3 minutes of your precious time, Dr. Devyani, but I can just talk about the branch.
No, sir, no problem.
With the experience I've had with my batchmates and other people around, So as Gobind sir did make a mention of the fact that, of course, this is an example of a branch which is going to be giving you sufficient time so as to maintain your work-life balance. For the simple reason that if you end up in a job, then obviously the labs are not going to be processing your samples beyond a certain duration of time. However, I must add over here that if you happen to get into a good institute, even during residency, you may be expected to work for a slightly longer duration of hours Especially that was a trend at two places, Mumbai as well as in Delhi, right? One good thing about the branch is that for most of the people, this happens to be the end of their career tunnel. So no more, I would say, academics, and that eases a lot of pressure on you. But during the 3 years of residency, obviously there is a lot of academics which has to be taken care of. So unless and until you happen to be somebody who's really passionate about it, we tend to get swayed by whether we were good in a particular subject or not during our MBBS days. But frankly speaking, yes, you do have to study a lot. In fact, I just wonder that if I had the same amount of passion or the same frequency of reading for the textbook like Robbins and others, maybe I would have been somewhere else. Having said that, once you complete your residency, you have got multiple options. One, of course, happens to be that you look and seek for a job. As is true for most of the branches, the jobs are going to be a bit limited, especially in the government sector. However, this along with other branches, I am sure Dr. Devyani and Ankur sir would also be giving you an insight about that. One of the branches where you can have your own setup, but that would be requiring some bit of capital input from your side, right? The other thing that you find practically is that people who are not too inclined to open up their own lab may do some kind of a freelancing wherein they are going to be looking at the reports in multiple labs. So they would be visiting 3 or 4 labs in a day. And that also, I mean, in totality would be paying you a handsome amount of money, right? Again, one of the branches which has evolved over a period of time and is likely to do so in the next few years as well, especially when you are reading about certain things like immunohistochemistry techniques and specific markers, or you look about something like, liquid biopsy. And nowadays, what is happening is that, just like people would be looking at their own specific, anesthetist when they're doing a surgery. Nowadays, what's happening is that there is a trio which is taking place, especially in oncology, wherein you have an oncosurgeon, you have their preferred anesthetist and their preferred pathologist, so as to report, because this triangle of people actually is going to be helping them in making an more accurate diagnosis, and that is going to be helping them in taking a better care of their patient as well. Again, just like psychiatry and anesthesia, pathology does offer you a very good opportunity to go abroad as well. Especially, I can vouch for that since 2 of my students, I'm pretty proud, in the last 1 year itself have moved to the UK. So things are a bit better over there with respect to, the work-life balance and the pay structure that you get over there. But of course, one important thing I would like to make a mention of the fact is that sometimes you are a very good academician, you're a good student, but then you do have a passion for looking at a lot of patients, especially that's what happens whenever practical training takes place at the time of internship. So if you're not going to be feeling bad about missing on your patients, wearing your state, then of course this is one of the branches which can offer you that particular thing. Another offshoot that we are having nowadays is that we are having offshoots from the branch. So even though we may not be having a specific super specialty, but then a lot of people who are going in for completion of doing their MD path or DNB path for that matter, and then they're going in for something like going in for specifically GI path only, or for that matter renal path, or for that matter the people are going to be picking up hemato-oncology, right? Second thing that's an offshoot is a new branch which is transfusion medicine, which a lot of you did make a comment of in the section as well. So transfusion medicine, of course, as you understand, would be required by all setups who are going to be having a blood bank with them, right? Since it has been a new branch, so obviously the number of people who have got that qualification as of now is relatively less. So, Path and micro at one point of time were similar. Path transfusion medicine were also combined, but they are now being, designated as separate specialties. So as the upskilling of the infrastructure at the hospital level is going to take up. There is obviously going to be a more advantage of the corporate sector, coming up with those specific needs of putting up people in transfusion medicine as well. So that is where we are going to be perhaps stopping our discussion on. All in all, a good branch, but being taken up by usually ladies. I'm not being biased, for the simple fact that it gives them plenty of opportunity to study as well, contribute in an indirect way along with the surgeons, along with the physicians in the patient care, but does give them the time to get back to home and take care of their families as well.
Dr. Sparsh, just one question, then Dr. Devyani ma'am maybe can take over. If I want to open a path lab, do I need to have a micro component in that necessarily?
Sir, initially there have been situations where people would have gone in for, let us say, a solo, project kind of a thing. But looking at the complexity of the cases, or for that matter, to avoid any kind of a future medical legal trouble for themselves, it is better that we employ specialized people for doing their designated jobs and, just do what is meant for us.
Oh, wonderful, wonderful. Thank you so much, sir. Thank you so much, sir. Now we can move to Dr. Devyani Puri, ma'am, please. Kindly share your thoughts about your subject, ma'am.
Thank you, sir. Hello, everyone. Am I audible?
Yes,
Yes,
ma'am.
ma'am.
Okay. So hello, everyone. I'm Dr. Devyani Puri, and I'm going to be talking about micro as a field. And the first thing that I want to say is that we as microbiologists, if we are not working at the back end, then in the front end, anything that the clinicians do is not going to help, because you can keep giving medicines to the patients and you won't even know if it's working. So all you're doing is you're just adding to the antibiotic, pool, and it's not going to work on the patient. If we don't tell you what works, you can give anything and it's just going to cause a lot of drug resistance. Okay, so starting with the first thing, why take up micro as a subject? Micro is never the first choice or even sometimes the second choice for students, because they think whenever you come to MBBS, you always think, we want to be a clinician. Why take up a paraclinical branch or anything? But I just want to tell you that micro is not anymore a paraclinical branch. It is as much a clinical branch as any other branches, right? So the first thing that you can do when you get into micro is you can obviously pursue your MD or you can pursue your DNB. I think we've over and over talked about is DNB better or is MD better? Both of them are equal. I think I have seen a lot of DNB students as well, and I can surely tell you that they're very, very good colleges who give you good DNB curriculum as well. So it doesn't matter if you do a DNB or you do an MD, you can do any of them and it's good. After doing 3 years of MD, one thing that you can do to add to your degree is something called a secondary DNB. So secondary DNB is something that you can do after MD, where you just have to give an exam post your MD, and it is just like an MD exam. So you give that exam, you give your theory paper, you give your practicals, and you can get an added DNB degree. So that is something which is called as a secondary DNB that you can do after MD. So after 3 years of your MD, anything you can go for an SRship. 3 years of SRship is there available. And if you don't want to go for an SRship, then there are obviously other options. Other options can be you can stay in a government college or a private medical college and be a professor, crack the UPSC and be a professor. It is a very nice job if you want to have a chill time. 9 to 5 ka job hai. You can, be a professor, go into teaching. If you're really passionate about teaching, then this is a very, very nice field for you. After that, if you don't want to be a professor, you can anytime join any private lab. So there are many, many private labs who will be willing to take you. And if so if you can go for a private lab also. Other than that, there are many pharma companies that take you. So if you do certain chota courses, then even pharma companies are willing to take you. So you do a lot of quality assurance purposes for the drugs and everything. So yes, pharma companies will be willing to take. Other than that, I have a few things. Okay, if you want to pursue a fellowship, micro does offer a lot of fellowships. So there are fellowships in virology that ILBS has. You have fellowship in your pediatrics, infectious disease that CNBC give. There are many, many fellowships, even the international fellowships that you can have. Right. Other than that, yes, the very famous infectious disease DM. So yes, microbiologists can pursue DM in infectious diseases. AIIMS Jodhpur has it, AIIMS Delhi has it. There are certain private colleges also that give you. So after you do this infectious disease ka DM, you will be like a clinician, you will be working in the ICUs, you're just like a medicine person. So yes, you will be a microbiologist, but you will be working as an infectious disease specialist. And most of the times, whenever you're making any policies around infectious disease, you're going to be the one that is going to get involved. Even in the hospital setup right now, me as working as a microbiologist, we have a hospital infection control team. So when you say that microbiologists don't have any contact with the patients, that's completely not true. We still take rounds in ICU. We go around seeing what antibiotics they are being given. We make the antibiotic policies for all the clinicians. We make the different policies of what to be prescribed in which situations during pre-surgery, post-surgery. So yes, we are very much involved. We do have to go on rounds to the ICUs to see the different patients and change their drug treatment if it's required. So hospital infection control also has many fellowships which you can pursue in the future. Other than that, there is obviously, if you want to go abroad, so there are many exams that you can give. You have FRC path. So a lot of people think FRC path is for pathology. No, it's also for microbiology that you can do in UK. So there are two exams, FRC path 1 and 2 that you can give, and then you can pursue your career in UK. There is also UAE as an option. So you have to give a Dubai Health Authority examination or the UAE examination, and you can go and pursue in Dubai. There have been very, very few microbiologists, so the demand is quite a lot. And then there are other places like Australia and everything where you have to give an exam and you can work. So that is about the international places where you can go. Then you have certain research labs also. So if you're interested in research, then definitely research labs are something that will be willing to take you. Even there are a lot of PhD people who are also there, but they definitely prefer an MD microbiologist when it comes to doing anything in research. Right. Other than that, I feel work-life balance is best, 9 to 5 job. And yes, talking about one last thing, private practice. Yes, you can open your private lab, as Dr. Sparsh has already said. It does take some amount of capital, but you can only start small. You don't have to go for big machines, buying all this MALDI-TOF, PCR and all these. Don't go for big machines. Have a small setup. Start with the basics, start with the culture, start with the basic things that we have. And then you can eventually over time establish your own setup however you feel like. Rest, I think, yes, it's a very, very good job. I hope I have convinced even one person to take micro. So I think my job here is done.
I
So
would
thank
rather
you,
do
sir.
that for you, apart from PSM. I think WHO does offer you a very good opportunity. A lot of
Yes.
institutes which are going to be the infection control institutes, right? They are the ones.
Yes.
And the upcoming thing with respect to microbiology, pharmacology, and I would say is going to be the increased awareness about the antimicrobial resistance.
Yes.
And
Yes, sir.
example, a lot of people are asking, say, for example, whether it is a preclinical, the clinical, the paraclinical, whatever the classification that you follow, about the salary structure. See, I would rather say it in a very general tone. You will always have sufficient amount of money for your needs, but none of us can even vouch for your greeds.
That's true,
So,
sir.
so no amount of money can ever be quantified to be sufficient. You see somebody who's having an entrepreneurial mindset, or somebody who happens to go and going for other higher risk taking abilities, may open something like Dr. Velumani, Thyrocare. Somebody comes up with something like Dr. Lal Path Labs. So no, somebody like Dr. Naresh Trehan opens up a setup like Medanta, right? So all these people are having a different kind of qualification if you look at the backgrounds. But what is required is a mindset. So if you have got that kind of a mindset, yes, of course, that is something which is going to be an individualistic thing, right? The second thing is, in general, I mean, irrespective of the branch, the kind of skill sets that you acquire. So sometimes you see a report of an individual, whether it is a biochemistry, guy, or a microbiologist for that matter, or a pathologist for that matter, they'll just make a mention of the fact such and such organism is grown, right? However, I have personally seen reports of people who have got sufficient exposure, let's say in the UK, US, and who we call by the name of the clinical microbiologist, who they would make a mention of the fact, this organism was seen, but we had certain amount of extra amount of tissue or certain cells were seen, which makes me feel that this may not be an appropriate sample. So instead of just growing an organism, putting it as a report of an infection, to maybe quantifying it as an example of a wrong sampling, that changes the whole quantum and the way the patient is being treated. So irrespective of the branch that you take, please focus on acquisition of the skill set. Don't think about salaries unless until obviously you have to have a basic idea about the salaries that you're expected to earn post your residency. But think about the amounts, after a certain duration of time. Please don't take any shortcuts. None of us who are sitting in front of you over here on the screens have taken it up. And I don't think in any branch for that matter, people are just going to become millionaires overnight after acquisition of any degree. Right, sir? Vivek, sir, I hope I have not taken too much of time.
No, sir, absolutely golden words you have mentioned at the end. And thank you, Dr. Devyani Puri, for presenting such a beautiful insight into the complete field. I think you have covered the whole microbiology landscape in your discussion. Thank you so much. Thank you so much. Now as everyone must have realized, we are going retrograde through your MBBS. So now I welcome Dr. Atul Gupta to share his thoughts on forensic medicine, sir.
Yeah, hi everyone. So instead of giving the opinion, I will just like to give the facts over here. in forensic medicine, the best part here is getting a job is easier than any of other branch, whether it is a government branch job or a private job. Okay, even in a metro cities like Delhi and all, it is almost surety that you will get a specialist job, and even high chances of getting a faculty job in a government college. In private college, there are ample number of jobs. If you want the job today, there will be 15 medical colleges which will have the vacancies. This is about the vacancies. So getting a job very easy, but if you ask about the what kind of work you need to do, there will be only two kind of work: either teaching or doing a postmortem. Please don't come with romanticize this as you watch foreign investigation programs or something like the CID and all. Those kinds of fancy things do not occur in India. So the infrastructure for forensic is basic in India. I will be brutally honest. It is mostly postmortems you will be doing and the teaching only. And if you ask me, you take it. If you want the work-life balance and those things, it will be great. But if you are looking for some fancy things over here, you will be disappointed.
But may I add over here, sir, you being a prime example of somebody, who has acquired a degree in forensic medicine, but as they say, acquisition of a skill set, sir is now working in a very prominent company and he's working in a pharma company for that matter. So again, the point is, what knowledge have you acquired? What is the skill set that you have and how are you utilizing it subsequently is what is going to matter.
So yeah, you are right, Dr. Sparsh, but here I would like to add one thing. See, 10% of the people can carve out their own path and no matter whatever skills, whatever degrees you have. But when we have to choose a specialty, that should not be based upon what 10% of the people would have been able to achieve. What we have to see is that what happens with 80% of the folks. So
Right.
this is my way of looking at it. See, 10% of the things, no matter even if you remain plain MBBS or even if you don't pass your 12th, there are ample, the world is open out there, you go and explore it. But when we have to make a conscious decision, then you should see what happens with 80% of the people over there.
So again, as a common man query, does picking up forensic as a branch also give you an insight or give you an opportunity to work with the lawyers as well?
Yes, I mean, you mean to say some kind of private practice, medical
Yeah,
legal consultancy? And
sir.
yes, you can do that theoretically, but it is like an exploring kind of thing. You really have to have an entrepreneurial bent of mind where you can go. It is something that you have to create. It is not something which is a routine thing that you will be easily be. For example, like a pathologist has to open a lab. That is a routine thing that a pathologist does. Making a medical legal consultancy, yes, there are people who have done it successfully, but that's not a common thing. I mean, you really have to be a street smart person, outgoing person, and it is like a new thing you have to develop. So it's not a very common thing, but yes, scope is there, but it's not an easy or common path.
Sir, somebody is asking a question. Is it true that the people in forensic medicine are going to be coming frequently in contact with a lot of high profile people?
Yes, you can say. No, high profile means, what do you mean by high profile? The police officers, senior police officers, common, senior lawyers, common, judges, magistrates, yes, all these things will be common. But that should not be a deciding factor by any chance in making your career decision.
No, sir, you made a very wonderful statement, which was very true. That please don't get emotional and please don't be emotionally driven by what you see on your TV screens or, for that matter, Amazon and Netflix. Sir has been very, I think, brutally honest about what is available so far as the scope of the branch is concerned.
Yeah, for example, I chose a different path and I was able to do well in life and something else. So something else you can do, there are hundreds of things you can do. But when I have to give you an advice, I have to see to tell you about the core thing which happens with 80 to 90% of the people where they end up. So that is my way of looking at the things.
Agreed, sir. That is why they always start off for you as Jai Gurudev. That's why you Gurudev, sir.
Dr.
But
Atul
Atul sir,
just
any scope of shifting out from India with this skill set after doing forensic? Just as you say, what is happening in Western world is very glamorous. So is there any scope of shifting to Western countries?
So if there are two things, if you want to shift to Middle East and all, then you can go with simple your degree as a forensic medicine and you will get a job over there in a medical college. Okay, that is the Middle East. But if you want to shift to a Western country like US or Western world, there you have to clear their licensing exam. It is just like an MBBS person who has to clear USMLE and then opt for some super specialization like forensic pathology and all. So that will not be related to your MD forensic medicine. That will be just like you have done your MBBS and now you want to pursue forensic pathology. So forensic pathology has an excellent scope in Western world, but that getting a forensic pathology in Western world will not be dependent upon your MD forensic medicine in India. It will be depending upon your ability to clear the licensing exams over there.
Dr. Atul sir, one more question has come from a student. Doing any law degree along with forensic, will that help?
It is just like adding a feather to your hat. Practically speaking, no use. But if you are a person who likes so much of showbiz and all those things, then yes. But practical benefit is not there. But many times, just people like to add the signatures to their name and that kind of thing.
बिल्कुल सटीक आंसर देते हैं डॉक्टर गुरुदेव.
Sir, actually, you
So
can.
because it's a matter of career, so I don't want to sugarcoat things, and I don't want to be opinionated. Just give the facts.
Absolutely, sir.
स्टूडेंट्स का एक
So
रिक्वेस्ट
correct
है.
me if I'm wrong. ये भी होता है ना कि you can be a part of only one particular professional organization. So either you can be a part of the medical.
अब दोनों काम नहीं, you can't do both law and medicine. That is not allowed.
No, sir, this is a very important query which a lot of people may not be aware about unless and until they are watching this from you.
Yes. You can either be a lawyer or you can be a doctor. You can't be both. You can do both the degrees, but you can practice only one.
Agreed. Very important, sir.
सर जनता जानना चाहती है कि आप ऐसा क्या कर रहे हो जो वीडियो ऑन नहीं कर सकते.
मैं ट्रैवल कर रहा हूँ, फैमिली के साथ हूँ, अब बच्चे पीछे बैठे हैं और वो बच्चे दोनों आप राक्षस की जैसे हैं, 10 साल का 16 साल का, दोनों लड़ रहे हैं एक दूसरे को. बहुत सारी चीजें चल रही हैं.
ठीक है सर, आप एंजॉय कीजिए. थैंक यू फॉर गिविंग द टाइम.
Thank you, sir. Thanks a lot.
Thank you so much, sir.
So now we come with to Dr. Ankur Jain, sir. Sir, thank you so much for patiently waiting for your turn. You kindly bless us with your words.
Thank you, sir. Good evening, all. As you know that we should choose our branch in which we have passion. Otherwise, you can't continue it for a longer time. And being a biochemist, I would say that biochemistry is not the first choice for medicos most of time. I have seen only few students who have chosen biochemistry voluntarily, but mostly what happens that we are going to non-clinical if we are not getting any clinical branch. But if you are really interested in biochemistry, I would say it is having a great future. Because if you are interested in biochemistry, definitely you are going in depth. You must have experience during your MBBS. The toughest subject is biochemistry. If you are interested in that, then you can go in research. And there is a lot of things to be explored. You can go in medical genetics. There is super specialty. You can appear in that. DNB medical genetics is available at Hyderabad and Gangaram. That is also having a good prospect. Other than that, you can go in academics, and just like Sparsh told that you can visit 3-4 lab centers, because nowadays everyone wants to be accredited by NABL, and in that there must be a biochemist over there to get that accreditation. So, and number of colleges are increasing day by day, so you can get academic. But now, if about earning, I would say it's not so much. That is the limit of the branch, and it is limit of most of the non-clinical branch. But if I say that branch is not going to pay you, is a person who earns. गोगा सर ने पहले ही कहा था कि ये तुम हो जो कमाएगा, ब्रांच तो कमा के नहीं देगी. कोई भी ब्रांच छोटी नहीं होती. Even you can earn a very well amount with biochemistry, and if you are planning to go abroad, definitely this branch will help you. So research work, it's good, and lab, you can own your own lab. That is also a good aspect. And the cons is that yes, amount is not so good. This is the any other question if student?
Sir, Dr. Ankur, a student is asking कि preclinical to clinical क्या हम move कर सकते हैं? तो from your biochemistry, can we move to clinical field in some way?
So previously there was, I do remember 6-7 years back, MD biochemistry was eligible to do DM endocrinology.
Yes, sir.
But nowadays it has been removed, but few more clinical branch has been added, which can be done by super specialization can be done by MD secretary. Oh, sorry, MD biochemistry.
Okay.
And I told you that medical genetics is an evolving branch. So वो एक बार student can explore that, and that is really really good.
Okay. Great, great, great. Wonderful, sir. Wonderful. Thank you so much for such a thoughtful insight into this branch, which everyone loves. Actually, we love it to study also. So, Dr. Govind, sir, any words before we conclude this session? Dr. Sparsh, sir.
सर जनता एक्चुअली जानना चाहती है श्रीकांत सर से, एक तो वो एनाटॉमी के बारे में तो सर प्रोफेशनली गाइड करेंगे ही हमें.
Sir, I think Dr. Shrikant sir had to leave. He messaged me. He had to leave at around 6:55. So, but it's okay. He'll connect with the students again on our Cerebellum channel.
Okay, sir. But for two people, I believe, Atul sir ke liye and for Shrikant sir, they had this query. Sir, how do you manage your happiness? So I think they should better take some life mentoring sessions and become life coaches apart from the subjects that they are teaching.
बिल्कुल सर.
ठीक है सर. अगेन आई थिंक वी हैव मिस फ्यू ऑफ द ब्रांचेस जो कि स्टैंडर्ड हम टीचर्स की नहीं है, लाइक रेडिएशन ऑन्कोलॉजी एंड इमरजेंसी मेडिसिन एंड फ्यू अदर ब्रांचेस आल्सो. सर प्लीज राइट डाउन जो हमारी ब्रांचेस मिस हो गई हैं, तो वी हैव टू इंक्लूड इन सम वे.
Absolutely, sir. Sir, what we can do is students who are still having any doubts persisting, they can connect with us on social media, either through Instagram, YouTube, or preferably over Telegram also, where we are very active. So you can tag us and we would be more than happy to reply to each and every of your each query of yours.
I think Dr. Praveen has rejoined.
Yes, sir. Sir has moved to another city, it seems.
No, sir. This is just a wallpaper. So, sir, I was in that conversation, sir, and I think everything was covered. So I think anatomy was left.
Yes, sir. Few things are left, but we'll cover it subsequently.
Okay, sir. Okay, sir.
So again, students, the most important thing what I can conclude from all the discussions is कि please choose the branch in which you want to do PG. ठीक है. MD, MS, DNB, डिप्लोमा doesn't matter. तो सबसे इम्पोर्टेंट चीज ये है कि जो ब्रांच में करना चाहते हो उसको करना. ठीक है. एंड देन वे दी ऑप्शंस जो आपको बेटर लगती हैं. एंड मोस्ट इम्पोर्टेंटली इफ यू कैन विजिट दी कॉलेजेस एंड डिपार्टमेंट्स इन पर्टिकुलर, दैट विल हेल्प यू अ लॉट इन डिसाइड.
Otherwise also, na, sir, I would give them a simple corollary maybe that helps them understand the psyche of picking up a branch in a far better way. Dekho, let's say you have somebody special in your life and you have fallen in for that individual. And then, your parents say कि एक बार और देख लो, decide कर लो, or you just go around and you see there is somebody who you don't like that much. But that somebody who you like less is wearing a lot of gold ornament, jewelry, comes with a lot of cash. Are you going to be putting up your life just for that extra amount of money or that gold that you're getting? तो ब्रांच में वैसे ही है यार. Please don't get swayed by the amount somebody is earning. You have heard about a lot of stories, Dr. A. Velumani की कहानी सुनी आपने, from a guy who did engineering to somebody who did PhD in biochemistry and then opened up thyrocare, right? Right. Or somebody who has opened up a chain of hospitals, or for that matter, maybe educational institutions. You should look up at people who are doing better in your profession just to get inspired. Don't have a direct competition with them. Don't have a comparison with them. The moment you are going to be having a comparison, obviously, some people are going to be doing inferior to you. Then you would perhaps justify it. Praveen sir would perhaps agree to that fact कि यार ये तो ऐसे ही था, मुझसे हमेशा कमजोर था. Somebody doing better than you would always, having competition and killing up your own joy. So please follow your passion in the sense that you have at least some liking for the branch. I know for certain branches, they are not the first choice ever for anybody. But there is something called as acceptance of reality as well. You have tried, you have given it your best shot, and then let us say you are picking up a branch, try to excel in that particular branch, try to acquire as much of skill set as possible. Rather than cribbing about it, if you feel that it is not meant for you, better take a drop, better take, something else. But once you say yes, please give all that you have for the branch. And of course, you would be finding that in due course of time, you would do better.
So if I may add, so that's a very important point Sparsh made here, that, it's not good to get stagnant. I mean, say you studied and, prepared for an exam, appeared for it once, twice, and say today you have to pick something, maybe not your first choice. But stagnation is never good. You should keep on moving, because when you start with something new, new avenues also start to open up. In our country, MBBS students have no idea what all they can do later on in life. And sir, I mean, think about it. All of us who are on the screen right now, none of us had ever thought that one day we would be starting an institute and teaching medical students. But when you start doing things, new things open up. एंड दैट इज द मोस्ट इंपॉर्टेंट थिंग. ये मत सोचिए कि आपको कुछ एक पर्टिकुलर ब्रांच चाहिए ही चाहिए. अगर देखिए, everybody has their weaknesses and strength. There might be a student whose strength is not solving MCQs, but that person might be very good at entrepreneurship. He might end up making a big company. And cracking an entrance examination does not ensure that you become super successful in life. ऐसा नहीं है जिसका टॉप 10 में रैंक आया वो बहुत सक्सेसफुल हो ही जाएगा. So there are multiple other factors involved. So if you could not do well in this exam, that does not mean you are a failure. You are a failure as a person. Please carry on. Please go to the next step. There are many, many things that can be done in life.
टोटली एग्री डॉक्टर प्रवीण. एंड आई विल लाइक टू से अगेन कि अगर आपको अपनी चॉइस की ब्रांच मिल रही है, दैट इज द बेस्ट थिंग. उसमें आपको देखना नहीं चाहिए कि एमएस है, एमडी है, डीएनबी है, डिप्लोमा है. अगर ब्रांच की कोई चॉइस है, वो मिल रही है, किसी भी फॉर्म में मिल रही है, बिकॉज द ब्रांच विल स्टे विद यू फॉर लाइफ. तो यू चूज दैट. ठीक है. अगर अपनी चॉइस की नहीं मिल रही एंड यू डू नॉट वांट टू स्टडी फर्दर, तो वेयर एवर यू आर सेटलिंग, वे करो, प्रोज एंड कॉन्स को वे कर लो, चूज दैट थिंग एंड वर्क हार्ड इन दैट. उस ब्रांच में अपना 100% दोगे तो ऑब्वियसली यू विल राइज.
बिल्कुल सर, इसी में ऐड करता हूँ, जैसे गोविंद सर ने बोला, फ्रेंड्स थोड़ा फ्लेक्सिबिलिटी लाओ अपने में. मेक अ लिस्ट, इवन इफ यू लव अ पर्टिकुलर ब्रांच, मेक अ लिस्ट ऑफ एटलीस्ट 5 to 7 फॉर योर सेल्फ. टेक पेन एंड पेपर, बिल्कुल ऐसे पेन पेपर लेके बैठो एंड मेक अ कॉलम, प्रोज एंड कॉन्स, राइट इट योर सेल्फ. आई थिंक देन यू विल गेट अ मोर क्लैरिटी ऑन द इशू एंड द ब्रांचेस. राइट सर?
और बहुत इंपॉर्टेंट है सर, वो पेपर को ना बचा के रखना अपने जीवन भर. हमारा ह्यूमन माइंड वैसे ही है, हम जो हमें प्राप्त हो रहा था उसकी वैल्यू अचानक से खो देते हैं. आपने एमबीबीएस कर लिया, आप किसी 11th या 12th के बच्चे से पूछ के देखो कि उसके लिए कितनी वैल्यू है सीट की, जो आप ऑलरेडी कर रहे हो या कर चुके हो. सडनली दे विल बी डाइंग फॉर इट. बट वंस यू हैव दैट पेपर, एज वेक सर मेड अ मेंशन ऑफ इट, प्लीज कीप इट विद यू, राइट? सो दैट एट एनी पॉइंट ऑफ टाइम समबडी ट्राइज टू पुश यू अस्ट्रे, तो आपको पेपर देख के याद आ जाए कि भाई उस समय पे मेरी इतनी रैंक थी, ये मेरी प्रेफरेंस थी और ये मैंने ले लिया.
और सर ये भी है कि ना, देखिए, थोड़ा सा मेडिकल कॉलेजेस के अंदर का एनवायरनमेंट टेंड्स टू बी वेरी जजमेंटल. I mean, later on you realize कि those things don't really exist outside the four walls of medical colleges. Medical colleges में तो एकदम बना रखा है ना, रेडियोलॉजी सबसे ऊपर, ऑर्थो, फिर ये और ये.
नहीं सर,
वो outside
नहीं
nobody
होता
cares.
ऐसे. वहाँ पे जो एनाटॉमी के फैकल्टी के प्रोफेसर है, उनकी सैलरी और रेडियोलॉजी के प्रोफेसर की सैलरी सेम है.
That
ये
is true, but
हमारा
medical
एक
students को
क्वेश्चन
लगता
है
है ना,
because of the
medical.
financials that are involved, so that actually tends to induce that bias.
सर ये ना मैं बोलता हूँ बच्चों से कि अगर आप प्रैक्टिस की बात करते हो, सो जिस डॉक्टर के सामने पेशेंट्स वेट कर रहे हैं, जिसको दिखाना लोग चाहते हैं, वो सबसे बड़ा डॉक्टर हो गया. चाहे वो न्यूरोसर्जन है, चाहे वो जनरल फिजिशियन है, इससे फर्क नहीं पड़ता. बट ये बात अनफॉर्चुनेटली सर हम लोगों ने भी बाहर जाके देखा है. इन अवर मेडिकल सिस्टम, पीपल थिंक दैट वॉट एवर इज हैपनिंग इनसाइड द फोर वॉल्स ऑफ मेडिकल कॉलेजेस इज द रियलिटी, बट दैट्स सो फार अवे फ्रॉम द रियलिटी. अब ये बात समझाना हम बता पाए बच्चों को अपने, तो बड़ा अच्छा रहेगा सर.
I
नहीं सर,
would like to
स्टूडेंट्स
add
को
कि मतलब दिस इज वेरी स्मॉल पोर्शन इन योर लाइफ, एंट्रेंस एग्जाम. तो स्टूडेंट्स जो जो सोच रहे हैं कि मेरा रैंक पीछे आया, मैं तो फेलियर हो गया, लाइफ में कुछ कर नहीं सकता, आफ्टर 10 years 15 years आपको भी अपना रैंक याद नहीं होगा. तो रैंक इज अ वेरी वेरी स्मॉल थिंग. तो लाइफ इज मच बिगर देन ऑल दीज थिंग्स.
सर स्टूडेंट्स बार बार जैसे बोलते हैं कि मेरे रिलेटिव्स क्या बोलेंगे अगर मैंने पीएसएम ज्वाइन कर लिया, तो मैंने कहता हूँ रिलेटिव्स को तो पहले अपनी लाइफ से बाहर कर दो. ब्रिंग टीचर्स इनटू योर लाइफ, ब्रिंग योर फ्रेंड्स इनटू योर लाइफ, ब्रिंग योर फैमिली इनटू योर लाइफ, देन टेक एन इन्फॉर्म्ड डिसीजन. तो रिलेटिव्स की चिंता मत करना, जो आपकी चॉइस है, इंटरेस्ट है, या जिसमें आप मेहनत करोगे उसी में आपको रिजल्ट जरूर मिलेगा.
और वही रिलेटिव्स आपके पीछे वापस आएंगे जब आप सक्सेसफुल हो जाएंगे. आपको क्या लगता है विवेक जैन सर को कोई खाली छोड़ते हैं आज? है ना. तो देखिए, ये मतलब मेडिकल डॉक्टर की जीवन जो है ना, इसमें सक्सेस और फेलियर की डेफिनेशन हर साल चेंज होती है. तो आप ये मत सोचिए कि अगर आपने आज पीएसएम ले लिया या कुछ प्री पैरा ले लिया तो आप नीचे रह गए. ये बदल जाता है. ये हमने अपने रिलेटिव्स और सब कुछ देख लिया बदलते हुए. So please remember all these things also.
And the final thing I would like to add over here is that please don't get swayed by any of the things which are being displayed on the social media, be it about an individual in your field or outside your field. There is a lot of effort which goes in the background. So today you see somebody like Ankur Jain sir coming up with a wonderful story or a mnemonic, and you feel कि वो बचपन से उन्होंने ऐसा बना लिया. बहुत मेहनत करी गई है. कई रात जागे हैं सर, कई महीने उन्होंने ट्राई किया उसके ऊपर, उसके बाद वो बना है. You see somebody like Vivek Jain sir, always reaching in all the discussions in time, and then you see his lifestyle and the kind of quantum of work that he's doing. You see somebody like Dr. Praveen sir answering your questions even at 3 a.m. in the night. Goga sir gets up at 5 and then doing some exercise and doing something. So please don't look at their cars only. Don't look at their suits. Don't look at their, I would say, the glamorous side of it. If you at all wish to be, drawing some inspiration, you better visit one-to-one. Some of them, if you ever get an opportunity, see the quantum of work that they're doing. In spite of being at a level that they are, none of them is working for less than 12 hours in a day. And I can give it to you in writing for sure, friends. If any of you is going to be working 12 hours a day, post your MD, post your SRship. There's nobody on earth who can stop you from becoming the topmost doctor or one of the best doctors in your respective specialty.
I think that should be the last comment, and that's so nicely said, so well said. Vivek sir.
Yes, sir. Sir, last comment from my side. Cerebellum loves you all. Dear students, whether you are from Cerebellum or otherwise, we want you to just succeed in life. Stay honest to your profession. Stay honest to yourself. I think you'll definitely succeed.
Goga sir.
So I will repeat what I started with. Scope branch में नहीं बंदे में होता है. So you just believe yourself. Whatever branch you choose, do well in that, and you will excel in life. And best wishes from my side.
Ankur sir, please.
I would like to conclude by saying that whatever you choose, remain attached with that and give your full energy, enthusiasm, and trust me, if you will give your 100%, you will shine in that branch.
So Vivek sir, with your permission, let's sign off.
Yes, sir. Any last words from Dr. Praveen sir, the universal boss?
Sir, I would just say that you might feel at this point of time, whatever you're going to do is going to impact you a lot. While it's going to be an important decision, life never stops giving you chances. So whatever you're getting, if you're getting what you wanted, great. Even if you have to pick something that you did not like in the beginning, there would be many more chances. All the best.
Oh, absolutely, sir. And thank you to Shubham, Muktaji, and the backend team from Cerebellum for staying with us for so long. Thank you so much, friends. This video is going to stay on Cerebellum channel. Thank you so much. Bye-bye. Take care.
All the best.
Thank you, sir. Thank you all.